A very warm afternoon to you, ladies and gentlemen, and welcome to day 2 of the virtual SDG investment fair, regaining momentum in SDGs implementation during and post-COVID-19. I am still, by the grace of God, Jerry Ajololo, and on behalf of the Ministry of Planning, the Ministry of Finance, the Ghana Investment Promotion Center, and the SDG Advisory Unit at the Presidency, I welcome you warmly to this very interactive session. Yesterday, we began with the opening ceremony. We were blessed to have the Minister of Planning together with the Deputy Minister of Finance on behalf of the Minister and the UN Resident Coordinator to Ghana share very warm and thoughtful remarks that set the tone for some very robust and stimulating discussions bordering around that theme. We got to hear great insights from Ambassador Martha Pobi on regaining our momentum in SDGs implementation, the socioeconomic impact of COVID-19. She was also followed by Mr. Yofi Grant of the GIPC, together with Madame Kosi Yankee Aye, on a post-COVID-19 vision of sustainable enterprises. We delved a little further into financing for development and the new normal. And we're blessed to have Mr. Charles Boama, former Senior Vice President of the AFDB, together with Madame Hamdia Ismaila, General Manager at the Venture Capital Trust Fund, bringing out the essence of financing for development in the new normal. We ended the day with a very stimulating discussion on the new normal innovations in education. Dr. Charles Apiedu, Associate Professor, Department of Finance at the University of Cincinnati, had a lot of breadth and depth of experience to share on the way we can innovate our education, especially in these times. Dr. Isi Ansah was a very great moderator who brought out all the salient points that were essential for the discussion. We'd like to say thank you to Mr. Peter Akwabwa, Managing Director of Morgan Stanley, for leading that great discussion on financing for development and the new normal. And also Mansa A.C. Ochre, a consultant and enterprise development expert, for leading us in that discussion on a post-COVID-19 vision of sustainable enterprise. It will be remiss of me not to also acknowledge the tireless efforts of Mr. Bernard Avle, broadcast journalist at City FM, for starting us off with Ambassador Martha Kobi. This afternoon, we gather here in furtherance of our theme that we're reflecting on as we look at three very important areas. Four, as a matter of fact, I beg your pardon. We're going to begin with telehealth and telemedicine, and then we'll delve into a private sector-led COVID-19 recovery scenario. We will then explore transforming business strategies, aligning the digital to the physical world. The future of work post-COVID-19 will be the last discussion for the day. But let's get interactive. Let's see who we have on board. As I go through, I see 29 participants so far. A big shout out to you, Mr. Francis Osei. I see Isaac Kojo, Mutai Ramokaini. Could you give us a wave? Thank you. Please indicate where you're joining us from. I see Madame Francisca Osei. Thank you for joining us. I see Francesca Nunu Achete, Cecilia Simone Costa. Say good afternoon to you. Let me say a big hello and welcome to Akosia Adidara and all of you who have joined us this gracious afternoon. Professor Honiba Boachieje is with us. Prof, I greet you. Thank you very much for making time to be with us. I have some good news to share as a precursor to our discussion, which comes up shortly. Just a while ago, I joined the NBSSI, the National Board for Small Scale Industry, together with the MasterCard Foundation, as they launched something very fresh and, uplifting. It's an industry first. It's actually the INCOSWAP program, a partnership between the MBSSI and the MasterCard Foundation. Forgive me, I haven't had lunch. It's a recovery and resilience program to support our micro, small, and medium enterprises. Now, this program, with an initial commitment of 90 million cedis from the MasterCard Foundation, will provide financial assistance in the form of grants and loans via participating institutions, including banks, fintechs, mobile lenders, NGOs, and business development services. The amount and type of financial support that will be provided to eligible qualified MSMEs, both in the formal and informal sector, will vary depending on the size of the enterprise, their need, and repayment capacity. You would bear me out that government did its part by rolling out the COVID alleviation program. And so far, the MBSSI has done a yeoman's job through the disbursement. So far, in excess of 200 people have received, support, and there's still a lot more ongoing. But this program will focus on supporting MSMEs in the following ways. MSMEs who need assistance to survive the impact of COVID-19 pandemic. And two, businesses in growth sectors where the employment of young people, especially young women, are being significantly impacted by business operation disruptions, supply chain challenges, liquidity shortages, declining sales and profits, and business closures. Thirdly, businesses providing services that have the potential to meet the growing demands of communities during and after the pandemic. Businesses that will focus on digitization to support SMEs. Now, the COVID-19 has challenged the world's economic system and every country has felt its brute force. What really excites me about today's launch is the fact that it focuses on women-led businesses. You would all agree with me that women have been hardly hit by this pandemic. They have to juggle the responsibilities of keeping the home as well as managing their business. And unscrupulous lenders have come in very handy, providing some amazing packages, but certainly tied with that bearable interest rates, which will end up ensnaring women entrepreneurs. For me, this comes in very handy to complement government's efforts, in this intervention to contribute to the collective effort to enable businesses, particularly SMEs, to recover from the economic shock of pandemic. I can say we are grateful to the MasterCard Foundation and for the MBSSI for this forward-thinking innovation. And so today, armed with this good news that has come in, we're going to explore further how we can regain momentum in this COVID-19 and post this COVID-19. We'll be blessed to have Professor Oneba Boache Eje, an orthopedic surgeon of the Focus Orthopedic Hospital, together with Dr. Tony Boret, consultant obstetrician gynecologist at the West Hedge University Hospital, shedding light on telehealth and telemedicine. Innovation has come greatly in the area of technology, and we'll see how we'll explore the benefits for Ghanaians and for Africans at large. Thereafter, we would have Mr. Edem Seshi, an associate partner at McKinsey, who would be hosted by Madame Amma Lati, the founder, Social Enterprise Ghana, on a private sector-led COVID-19 recovery scenario. Mr. Kojo Hesse, director of Express Pay, would take on Madame Lucy Quist, the managing director of Morgan Stanley, as they talk about transforming business strategies, aligning the digital to the fiscal world. And lastly, Madame Iyawa Hansen-Kwao, founder and director of Leading Ladies Network, executive director of Emerging Public Leaders, would host Madame Ashiokai Akron, the director, Human Resource, Vodafone Ghana, on the future of work. It promises to be very insightful and illuminating. For the next few minutes, while we tarry, I would entreat all of us to please share today's link with our friends who can't access this platform that we may like to view on YouTube. Our YouTube channel is Accra SDG Investment Summit, and we're currently streaming live. So for all those who are unable to join on the Zoom platform, please share this platform with them, and we'll be glad to have them join. Our chat box is also available for you to engage with us by way of your questions, your comments, your suggestions. And hey, if somebody is touched with the prophecy too, we'll take that in good faith. So while we wait, let me leave you to put your things together. I'll revert in about 5 minutes' time and we'll go live with our panelists. Thank you for joining us once again. You're welcome. Great. Wherever you're connecting with us from, this is day 2 of the virtual Accra SDG Investment Summit, regaining momentum in SDGs implementation during and post-COVID-19 is the theme we're reflecting on. We started off yesterday on a great note, and today we begin in the same momentum. It is worth noting that, well, Ghana has made some tremendous strides in this era, but there still leaves a lot more to be desired, and for which reason we continue in the second day. We're blessed to have all the requisite resources and people that will make our discussions meaningful. We're joined this afternoon by high-level government officials, community facilitators, investors, civil society, entrepreneurs, academia, and other broad stakeholders whose inputs will shape a sustainable collective network to achieve the goals that we've set for ourselves. We begin this afternoon with a conversation, a crucial one at that, on telehealth and telemedicine. We're pleased to have Mr. Yao Asamoah, Director of Focus Orthopedic Hospital, who will be hosting Professor Heniba Boachie, an orthopedic surgeon and the founder of Focus, together with Dr. Tony Boret, consultant obstetrician gynecologist at the Westhurst University Hospitals NHS Trust. Over to you now, Mr. Yao Asamoah, and your guests.
Good afternoon, everyone. I'm Yao Asamoah. Welcome to our telehealth discussion panel. We've got a great discussion teed up for you all this afternoon, and hopefully you'll enjoy the topic. It's very timely given everything that's going on with COVID. We've got two very distinguished panelists with us today. First, Dr. Tony Boret. Dr. Boret is a consultant OBGYN and a clinical lead for fetal maternal medicine with the Westhurst University Hospitals system in the UK. And Dr. Boret has held numerous management positions within the Westhurst system. He's been practicing for well over 30 years in Russia and Ghana, and obviously most recently in the UK. So he's very experienced and conversant in this topic. So we're delighted to have him with us today. And then we have Professor Heniba Boachie, who is the founder of the Foundation of Orthopedics and Complex Spine, CEO of Focus Hospital in Accra. And Prof, as he's affectionately known, has over 40 years of experience practicing throughout most of his career at the Hospital for Special Surgery in New York. And he relocated to Ghana about 6 years ago to run the Focus Hospital full time. So we're delighted to have him with us as well. And then I serve as a board member of the Focus Hospital, and I'm also the former chairman of the Focus US Foundation, which supports the work of the hospital. So we're all delighted to be with you today. I think telehealth obviously has come to the forefront given all that's happening with COVID. But to set the stage, I think this was a very interesting growth industry even prior to COVID. There's not a lot of statistics about the platform as a whole, but if you just look anecdotally at some of the trends. If you look at Teladoc, for instance, which is the leading company in the sector, they reported that leading up to 2019, the last 5 years, from 2014 to 2019, they saw a compound annual growth rate of over 65% in terms of the number of patient visits using the telehealth platform. In 2019, they recorded over 4 million visits. So which is certainly interesting. So clearly, even leading up to COVID, this was a growth area and a platform that more and more people around the world were starting to use to access medicine. There are also other estimates. Numerous studies have been done. There are other estimates out there that over 40% of Fortune 500 companies provide some sort of telemedicine platform for their employees. So clearly, this is a vehicle that can be impactful if harnessed the right way. So we're going to spend a little bit of time talking about what the implications are broadly and for Ghana as a whole. So maybe with that, I'll tee up the discussion and throw it first to you, Tony, for the first question. can you maybe expand a little bit on the trends and the dynamics that we've seen in telehealth broadly? What do you think the key drivers are for some of this exponential growth that we've seen leading up to the current climate? What sort of drivers do you see, above and beyond COVID?
Right. Okay. Thank you, Yao. Now, I'll try and build up on what you said. As you rightly said, telehealth has probably been one of the fastest growing markets in the world economy. There's been a huge explosion of use even before, the COVID pandemic hit us. In the past 12 years, it's grown from a multi-million pound industry to a multi-billion pound industry. And as of 2018, it was thought to be worth in the region of about $15 to $18 billion. This COVID pandemic is likely to be a game changer. And what it has done is it has forced a lot of healthcare practitioners and healthcare administrators to look at alternative ways of delivering healthcare. And this is dovetailed into the growth in the use of telemedicine platforms in general. Prior to this, there was a huge wide variety of uses and areas where telemedicine was used, primarily teleradiology, as Prof would well know, telecardiology, telepathology, ambulatory monitoring of patients. In the UK, huge growth in the development and use of digital apps and platforms to access primary care, what we call GPs over here, where people could just, plug into access healthcare services on these platforms. The most systemic example and wide one would be the NHS 111 system, where anybody could access healthcare by just calling the 111 number, speaking to a non-medical trained person behind a computer who puts your symptoms into an algorithm and offers advice over the phone, or offers treatment advice or advice to either attend the accident and emergency department or to go see your GP. So this, all of these, sort of have shown that I think that we're looking at the traditional models of delivering healthcare in the developed countries, and to a certain extent in developing countries, is going to change over the next few years. And we are going to look at different ways of delivering healthcare using digital platforms. That is without a doubt, that is on us, and that's the way we're going. I think that in Ghana, we are well placed to take advantage of that. Telemedicine solutions are wide and varied, some cheap, some expensive, but I think that with good analysis and good identification of the areas we want to grow, areas where we can get quick gains, there are very cheap telemedicine solutions available, which can be implemented, and if implemented in the right way, can provide huge cost benefits and huge, improvements to health outcomes in aspects of healthcare.
Great, thanks, Tony. Maybe switching over, Prof, let's get to I think Tony gave us a very good macro summary. Maybe let's delve into the micro a little bit. Can you give us a sense? I know at Focus, given the recent shutdown, we've utilized a lot of telehealth platforms to treat patients recently. Can you maybe give us a sense and give us an example of some of the cases you've treated recently using this platform? What worked well? What didn't work well? What were some of the lessons learned?
Well, and thank you again for inviting me to this platform and this symposium. As Tony said, telehealth is really not new. It's been in practice in the early 20th century with electrocardiogram transmission over the phone, and then in the military also. Specifically, our experiences and applications have been in e-learning, especially with the Hospital for Special Surgery affiliation that we have. And that's something we did early on, so that we log onto their e-learning platform so we can have virtual consultations, communications, and training for our staff, especially in the physiotherapy department and the nursing department. We've been able to get the Ghana's only 2 certified neurophysiologists by using this mechanism, whereby they have had online training by the neurologist in New York and have been able to actually take the board exams and pass the exams and be certified without being physically in the United States. And moreover, because we don't have a radiologist here at Focus, all our images are on the picture archiving and communication system, which is transmitted to a radiologist at Kolebu, who then reads our images and sends us information and with diagnosis and treatment recommendations. And we also do the same with the radiologist at the Hospital for Special Surgery. We have a weekly conference using the Seattle Spine Foundation Surgical Skills Teleconsultation Program so that we can actually have a full curriculum for our training physicians and surgeons. Now, we have established a Polycom video conferencing system here at the hospital so that in surgery, I can actually sit in the conference room and view synchronously the procedures that are being performed in the theater, and basically advise and guide and walk them through step by step as to what should be done without being physically there. And this has become very, very practical and very beneficial for us, especially when COVID hit us, to the point where we started with a teleconsultation. So all our patients are phoned, and then information is taken over the phone. We can actually view their images with them, discuss everything with them before they even come into the hospital for diagnostics, whether it's radiography or laboratory, and then eventually are seen by the doctor, which will only take like 2 minutes because we've done all the work. And basically we'll be seeing them for perhaps a consent for their surgical procedures. So the benefits are immense, and we've seen how it has supported clinical practice at a distance, saving time and movement. And we've been able to overcome the geographical barriers connecting users who are not in the same physical location using the various forms of information and communication technology. Now, a very good example is several years ago when I was in New York and I was actually at a meeting in Virginia. I got an email from my office in New York that there is a message from South Africa. So I looked at the message from South Africa, and then it was basically a friend who has also received a message from Nigeria about a lady who has had a spine trauma and was paralyzed. So immediately I connected with the lady, with the consultant in Nigeria. WhatsApp images were sent to my phone. I relayed that WhatsApp information to Kolebu Hospital, where I had trained one of the earliest or youngest spine surgeons. So basically, in a matter of 1 hour, we were able to have a 3-continent communication: Nigeria, South Africa, Virginia, New York, and Kolebu. And we were able to actually come up with a diagnosis. Within the next 2 hours, the lady was actually on the plane to Ghana and had surgery in 24 hours and was able to recover full function, traveled to the US subsequently for rehabilitation, and then had a master's degree and went back to Nigeria. So without telehealth, it would have been impossible to provide guidance and treatment options for this lady who otherwise would have been paralyzed. So it has immense benefits that should be harnessed by the country, especially in this era of COVID, and in a situation where we don't have the healthcare professionals or the physical infrastructure to really manage all our health needs, which will bring us to the Sustainable Development Goal 3 objective of providing healthcare for all.
That's good. And Tony, how about you? What sort of recent experience have you had with some of your patients on using this platform?
Well, I mean, nothing as exciting as Prof in linking 3 continents. But essentially, yes, I mean, leading up to COVID, we did use a lot of telemedicine platforms with regards, I mean, me providing tertiary advice to outline hospitals on fetal medicine and maternal medicine issues for complex cases. multidisciplinary discussion of complex cases with between specialists of different groups and GPs. Specific to what I have seen more because of COVID is that we're now doing a lot more video consultations. And in my personal practice, my face-to-face consultations have decreased by about 30 to 40%. So whereby I'm seeing you're consulting and offering medical advice to a lot more patients over the phone, decreasing attendance at hospitals. What we're doing, just like Prof is saying, is that for those who need to come to hospitals after your teleconferencing, you can organize the diagnostics. So by the time they come into the hospital, they're all well prepared and don't have to spend too much time, and they can go forward with their treatments. What we're doing a lot now recently is a lot of ambulatory monitoring of patients. So in my personal practice, ambulatory monitoring of blood pressure trends with the hypertensive disease in pregnancies, and with the gestational diabetics, monitoring of their blood sugar levels. So these patients, what they do from home is monitor they have their glucometers, which sync by Bluetooth to the apps on their phone. And then, so anywhere they are, we can access it centrally, see what their blood glucose levels are doing, and send them advice either by email or on the app as to whether to increase, decrease their insulin levels and what to do to change the management of their diabetes in their pregnancies. So that's really essentially what we are. I mean, that's how it's impacted most on my practice. Yes.
That's a pretty significant number to have 30 to 40% of your visits being done via this platform. I think is really interesting. So I think, the ticket, it seems like certainly when you look at the UK, the US, the developed world broadly, this has really taken off. Maybe switching gears a little bit into Ghana, I'd love to have your perspectives, maybe starting with you, Prof, and then Tony, on, are we really seeing this platform having the same type of momentum in Ghana? And if not, what are some of the challenges to getting it, to having it be more adopted?
Yeah, so what I would say is that the WHO has been tracking countries that have telehealth strategies and policies to outline the visions and objectives regarding the application and provision, as well as the control and standards and ethics related to national and international use. So we were named as one of the countries back in 2010 and 2015 that Ghana has adopted the e-health policies and strategies, which is very good. And then if we go back to about 10 years ago, the Novartis Foundation started the Ghana Telehealth Program and actually came up with a Ghana Telemedicine Toolkit. So it was a pilot program that started in the Amansi West District of the Ashanti region back in 2011. And this covered about 30 communities, 35,000 people. And based on the pilot program success, the Ghana Health Service selected it for implementation across the country back in 2019. So I believe this is a good start based on the pilot program success and implementation across the nation. And based on the Novartis Foundation decade of experience here, it's basically been one of the best digital health systems that have been able to actually provide healthcare using just mobile phones, for instance, to a countless number of individuals. Some of the challenges are, and this is universal, most commonly in the developing world and the low middle income countries, which were one of them, is the number one is the financial cost, and the underdeveloped infrastructure and the lack of technical expertise. The developed world's challenges are usually the legal and the ethical issues about patient privacy and confidentiality, and also the complex human and cultural factors, linguistics and cultural differences between patients and service providers. But for us, the main challenge really would be the financial outlay and the infrastructure that is required, especially in the information and communication technology. Now, we're talking about 4G and 5G in the developed world. Here, we're struggling with 2, 3, and 4G. So once that becomes readily available, I think we'll be able to reach the goals that have been established and created by the Ghana health system. So those are really the main barriers which I think the government has to take into consideration and make that a significant portion of the healthcare dollars as the budgets are prepared.
Great. Tony, any perspectives as well?
Yes, I mean, just Prof has sort of outlined most of the barriers which sort of are inherent in trying to develop a telemedicine system or telemedicine platform in a developing country. Saying again, I mean, I think one of the issues or some of the failures of telemedicine projects that have been started in sub-Saharan Africa have been that most of them have been designed for use in developed countries and having taken local context into account. I think that is one of the key areas when developing a telemedicine solution in a developing country, considering our wide cultural and language differences, is to tailor it into that. Talking about ICT and internet access, I mean, I think we are way ahead of the curve in sub-Saharan Africa, in Ghana. And I think this is something that we should take advantage of. I mean, I think I may be wrong, but I understand that the government has or is in the process of laying 5 new submarine fiber optic cables, which will provide really fast bandwidth internet. And the goal is to provide internet connection to 99% of the country by 2020. Probably COVID would have slowed that down a bit. But hopefully by 2022, 2023, we should be able to provide high bandwidth internet to 99% of the country, which is good news and which provides the necessary platform or for the vital platform for any telemedicine solution.
Yeah, great.
Now, so just going to add to it. So just for telemedicine, again, I think it's important that we look at simple solutions first. So simple things like using mobile phones. I mean, we all know how the financial sector has used mobile phones to provide financial services and banking services to rural and remote areas. And it's been hugely successful. And I think in healthcare, this is something we should be looking at. Using that same platform, whether it's a simple way of just developing unidirectional health education messages to the remote areas in terms of health practices, I think it's something which we can get a quick win from. But so partnering with financial and the local financial and banking establishments to using their digital platforms as a telemedicine tool.
That's great. And then maybe along those same lines, Prof, if you could make any, if you think about sort of low-hanging fruit or, a wish list of policy or strategy implementations that you think could have a big impact in improving telehealth access or telehealth delivery in Ghana, what would you say?
Yeah, I think as Tony said, the platforms that are cheaper and are also very ubiquitous and user-friendly and versatile, mobile phones, social media, those are very easy to implement and to get the information through either as a store and forward format or synchronous communication. So those are available. I believe maybe 80% of Ghanaians have mobile phones. But for low-hanging fruit, we talked about the human resources. And the whole idea of telemedicine is to get healthcare delivered at a distance. If we had a plethora of specialists in every district hospital, every community hospital, it may not be as critical other than for the high-level care. But since we don't have enough physicians to 1 to 8,000 population, I think the use of diaspora physicians and specialists, for instance, is very, very, very easy to come about. Now that we've been able to communicate with them in an e-learning programs, we can establish a physician specialist bank for regular scheduled consulting with telehealth centers that are established across the entire country. If every district hospital has a teleconsulting center, we can easily tap into that with our physician specialists in the country and also in the diaspora as an advisory group to support this process. And they can also help with policy and strategy organization, and then help upgrade and increase the regional teleconsulting centers through the community, district, and then sub-district levels. I think this is one area that can readily be harnessed, utilizing the diaspora physicians and the specialists especially, and specialists in the country through e-learning, specialist bank, advisory group, but more importantly, strengthening the teleconsulting health centers. And that's what I think should be established. And so my wish list will be to establish more teleconsulting health centers across the country that can be tapped into by any program that is ready to deliver healthcare to the local physicians and healthcare providers.
No, I think that's spot on. That's a great suggestion. I think in some of the work we've done recently, I think one of the key areas or key obstacles that we've identified in terms of healthcare delivery in Ghana is the lack of adequate number of trained doctors and nurses to be able to help provide that care. Do you have a sense of how many diaspora Ghanaian physicians we have in the U.S. and maybe Tony, you in the U.K.? What's the pool of people that are available if we can have the right platform set up? We could then tap into to help deliver care in Ghana.
The recent communication with the Ghana Physicians and Surgeons Foundation in the U.S. stated that about 2,000 Ghanaian physicians in the U.S. alone. That's half of all the Ghanaians in the country. That's a lot. And almost all of them, 90% are specialists.
Wow, that's incredible. Tony, what about the UK?
Yeah, same thing. The numbers are similar in the UK. I mean, I think officially about 1,600 doctors, most of them specialists. I don't know about general practitioners, but we have about 1,600 specialists, Ghanaian specialists, spread out in the UK. And most of which would be more than willing to offer their services if required to.
Yeah, that's incredible. So,
they wouldn't have to travel. Yeah, they wouldn't have to travel to Ghana all the time as we've been proposing. Coming to Ghana for 2 weeks at a time. I mean, that's good, but the same purpose can be achieved from a distance.
Right, and certainly there's significant efficiencies and cost savings that can come about when we take that approach. So I think this brings us towards the end of our session. I want to make sure we leave enough time for Q&A from our audience. But give you the last 30 seconds to each of you if you have any final thoughts. Otherwise, we can open it up for Q&A.
Yeah, the telehealth ultimatum to me is that it is a must. It's not an option. And I think to achieve its potential, telehealth should be considered an essential part of the healthcare system, just like hospital beds. And it should be numero uno in the minds of the healthcare providers, the policymakers, Ghana Health Service, Ministry of Health, and also the Ministry of Finance in their budgeting. So we can increase the healthcare expenditure from 3.5 to hopefully 7, 8, 9, or 10, making telehealth budgeting a significant part of this agenda. The goal is universal healthcare. And you can't reach universal healthcare and achieve your Sustainable Development Goal 3 if you can't reach everybody and make healthcare accessible.
Great. Tony, final word?
I fully agree with that. Now, probably what I'll just add to it is that I think COVID has brought along a lot of awareness, especially in the private sector. Now, the general feeling is that the private sector now is much more willing to invest in healthcare, having seen how a poor, an unhealthy population, how COVID has negatively affected economies. And there is that realization in the private sector that about the strong link between a healthy population and income generation or wealth generation. So I think that with the private sector now more willing to enter into private-public partnerships in healthcare development is something which, probably especially in Ghana, we should try and tap into and ride the wave and use that to develop, as Prof said, our telemedicine facility centers along, yeah. That'd be my final goal. So tapping into the private sector, I think we'll be much more willing to put money into healthcare.
Okay, great. Thank you all for those brilliant insights, and I think we can now open it up to Q&A from the audience. Hi, good afternoon again, everyone. Hope you enjoyed that insightful discussion. You should all see a poll that just popped up on your screen. If you wouldn't mind just taking a few minutes to fill out the poll, that would just we just want to get a sense of who's in the audience and what sort of participation and interest we're likely to get from a Q&A perspective. So if you wouldn't mind just taking a minute to fill that out, that'd be great. And then as questions come up, please feel free to use the chat, and we'll try to, we'll endeavor to try to answer as many of your questions as possible. Okay, so it looks like we've got a really good diverse group, about 25% government officials. We've got a fair number of investors as well, between and entrepreneurs, and then a good mix of civil society and students as well. So that's a pretty good audience to start with. So maybe I'll kick it off. Tony, I see you're on. Prof, are you on? You have Dr. Bachi on? Maybe let's just give it a second while we wait for Prof.
Yeah, you have to ask Prof to unmute.
Well, if you're okay, Prof, you're good?
Yeah, unmute me.
We can hear you.
Do you hear me?
Yeah, we can hear you. Okay, so there are a number of questions that have already come in via email, so maybe I'll kick off with some of that. We've got a question with respect to where we sort of ended the discussion. Prof, you spent a lot of time talking about the diaspora and mobilizing the diaspora through this telehealth platform. There's a question with respect to how do we actually formalize this? What are the incremental steps we can actually take now in order to bring this to fruition and achieve some of these goals? Maybe I'll kick it off to you to start with some points on that.
Sure, good question. I think this can be done in consultation with the Diaspora Physicians and Surgeons Foundation, and the groups in Europe. Basically, by communicating with them and meeting with them, we can draw up plans for definitely getting the database of the specialists, which we have an idea of. Also mapping out the same in the healthcare institutions in the country and where help is needed, so that a schedule can be drawn up as to who needs what type of help, and also a curriculum, in addition to basically medical diagnosis and treatment platforms. But this will require a collaborative effort between the Ghana Health Service, the diaspora physicians, and then the institutions in the country to be able to come up with a solid plan. Of course, putting in place the necessary infrastructure to also be able to achieve that seamlessly.
Good. Tony, any thoughts on that?
The GPSS people are pretty ready for this kind of activity.
Good. Tony, any thoughts on that?
I mean, Prof has summarized it perfectly. It's about a start point and creating a strategic partnership between all the different organizations, both locally in Ghana and in the diaspora.
And are there, along those lines, are there any sort of practical issues such as licensing, barriers to be able to get doctors in the diaspora to be able to effectively practice in Ghana that we can sort of address or streamline to help move this process forward?
Yeah, those barriers are more prevalent in the developed world, but that's not something we should overlook. Certainly, we don't want malpractice. Somebody has to be responsible for the care and the advice that is being given. So I think this will have to come from the Ministry of Health and the Ghana Health Service as to the legality and the coverage that will be accorded the participating specialists. But I think that certainly can be worked around. Certainly, patient confidentiality is very important. HIPAA compliance is very critical, but these are legal issues that can easily be worked out. If somebody is going to give, and of course, licensing can easily be done by submission of CVs and practice patterns and experiences and country of residence licenses for reciprocity. I think this can easily be worked out. It should be the least of the barriers.
We have another question on, again, the diaspora topic, which people seem to be very interested in. Are there any plans to tap diaspora physicians to also play a role in the training of our medical students, which is obviously a pretty important factor in building our pipeline of professional resources in the healthcare space? So are there any plans to use the diaspora to help in the education of our medical students?
I'll take this one.
Yep.
Yeah, okay. I mean, I think it's all about the initial organization. And I think the will is there to provide all forms of collaboration with healthcare facilities in Ghana. Now, telemedicine and telehealth is not just about treatment. It's about education. It's about providing treatment. It's about primary prevention. It's about public health messages. And with the start of any conversation, all these should come into the organization of it, whether it's education or whether it's provision of acute care. I think out here, I can talk for the physicians here in the UK, and I'm sure the same holds for physicians in the US. There is a big will and willingness to help in whatever shape or form, whether be it teaching of medical students, be it providing support to specialists in training, in whichever way or form. And going along digital platforms would be an easy way to regularize and help provide whatever developments are out here to be introduced back into healthcare systems in Ghana.
What about, and maybe Prof, you can take this one. What about, we spend a lot of time talking about the shortage of doctors, but what about physician assistants, nurses? What gaps exist in those areas, and how can we also, what sort of plans can we put in place to help address that to further supplement healthcare delivery in Ghana?
Yeah, unlike the physician population ratio, disparity in the country is a little different on the nursing side. There are a lot more nurses for medical practices. Most of them are clinical nurses. Very few nurse practitioners. So this is also an area that can be extended by the participation of the diaspora nurses. There are nursing groups in the US that I'm aware of. Most of them are nurse practitioners, and I'm sure the same exists in the European countries also. So the format that is laid out for physician can easily be translated into the nurse practitioner aspect of this. And having so many nurses in the country, it's like something like one nurse for every 500 or so population, which is a significant improvement. And if you compare to the one physician for something like 8,000 individuals, which doesn't meet the World Health Organization standard of one physician for 1,100 people. So the next area is pretty good, and I think that can also be taken care of in a similar manner as the diaspora physicians' participation. This will require not only the Ghana physicians and surgeons, or the Ministry of Health or the Ghana Health Services, but also the Ghana College of Physicians and Surgeons. There is the Nurses and Midwives Council also. So similar collaborative efforts can take place between the diaspora nurse practitioners and the Nurses and Midwives Council team members.
Tony, there's a question on financing. I'm going to put you on the spot a little bit. Obviously, you're a doctor, not a banker, but there's a question with respect to what sort of private financing models might be available or could be explored in Ghana for telemedicine. Perhaps maybe you've seen something in the UK, for instance, that could be applicable, but if you could maybe address that, that'd be great.
Yeah, okay. Now, in terms of financing and investment, probably what I'll start by is saying that, I mean, looking at Ghana, let's take Ghana for example. I mean, Ghana is one of the fastest growing economies in the world. Now, on the back of that, investors obviously are interested in what kind of investment opportunities will be there. Now, with looking at telehealth and telemedicine, I mean, if properly structured, there are investment opportunities. So some of the drivers which I think are important here for investors, obviously any investor is going to want some element of guarantee that they will at least get back some returns on their investment, without a doubt. Ghana has put in place a lot of structures in terms of regulatory and governmental support to encourage the telehealth and telemedicine environment. Now, with that, you tend to have the payer. So these are international developmental agencies willing to come in. The whole reason why telemedicine projects tend not to last or there's a reluctance is about its sustainability. Now, if those conditions are in place for the international developmental agencies, together with government support, with financial and otherwise, and the right regulatory climate, you are much more likely to have the private sector, which is the pharmaceutical industry, who I know are very key because they get a lot of data, they get a lot of support in terms of their stocks, in terms of feedback from the drugs and everything, and we'll be able to do that on the telemedicine platform. So the private sector, which are the telecoms operators, the pharmaceutical industries, the digital industries, they will be willing to come in, they will be willing to put money in to keep these projects sustainable. So I think we've started well in that Ghana has created a good foundation in terms of governmental support. I mean, we know that Nana Akufo-Addo is one of the, I think, the co-chairs of the SDG, United Nations SDG advocates. So they've created a good environment and for the development of telemedicine solutions in the country. What we need is all-round strategic partnerships, a strategic approach by a wide sector of stakeholders. There's governmental, non-governmental agencies, the private sector, the community leaders, doctors, users, everybody coming around and drawing up a proper strategic telemedicine approach. With that, the investment community, the private sector would have more reassurance and be much more willing to pump money into the system to get it going once and for all. There's huge gains to be made. There's money to be made from the investment sector. All they want is the right condition.
That's very helpful. One of the things we've talked about in our earlier segment was infrastructure. Obviously, I think we all agree, and most people on the in this call agree that infrastructure is it's a very important component of being able to deliver on a telehealth agenda. But I think we also recognize that, particularly in the remote and very rural areas of Ghana, some of this infrastructure doesn't exist. And so in those instances, maybe Prof, you can tackle this one. What would be your recommendation if you were speaking to the Ministry of Health, for example, in terms of how that should be tackled? How do we deliver telehealth services to citizens in the remote and rural areas where the infrastructure issues may be much more pronounced?
Yeah, so a very good question. And that's one of the barriers that I mentioned, the information and communication technology aspect of it. So internet is very critical. Nowadays with mobile devices and tablets, it's very easy to get even low bandwidth messages across. And it could be basically receive, store, and forward, such as email, WhatsApp. I mean, about half of Ghanaians, or maybe more than that, are on WhatsApp now. And you can use that platform very easily, communicate with, as long as there's an interface or a platform developed well to connect the physician and the patient, that can easily go through the mobile device systems. That's the first thing. And then I think district hospitals should have an infrastructure established in a central location whereby messages can go through that location and be distributed to either the physicians in the hospital, whether it's during their clinic time, and then relay to consultants, specialists, wherever they may be regarding a particular problem that may come across their desk. So I think the information and communication systems are the key for the district and sub-district hospitals. And their mobile technology is very, very easy to get messages across if the platform is built well. And this is where the investment should be made.
But does that mean though that the type of care that you can deliver is going to be very sort of basic and rudimentary because you're using WhatsApp and you're really just sort of sending messages back and forth?
So you're basically addressing one, appointments can be done easily that way. Two, information about patient care or patient medical condition can also be obtained that way. And then three, diagnosis can also be obtained by sharing information on laboratory data. Laboratory data doesn't need a huge platform. Radiological data doesn't need a very huge platform. It's picture, shoot, store, and forward. So those can easily be obtained. So by the time you actually get to the crux of the matter, you have enough information to share with whoever the primary care physician is. And it could be a complex medical issue that with the appropriate information shared between the consultant and the local physician who is also connecting to the local patient, much of the decision can be reached at the point where a medical diagnosis can be made and treatment offered or second opinion. When it comes to procedures, that's a whole different ballgame. There you need very advanced systems where video can take place, because then you have to see. You can do simulation training on video if you have good high speed or good broadband. So the surgical specialties will be the challenge because that requires technical involvement. But with the e-learning programs that are available, procedures can be learned online very easily, and then they will have to be accompanied also by establishment of laboratories like Da Vinci laboratories, whereby surgeons can then go in and do special trainings, procedures on cadaver, and can be instructed also via video by experts who will be instructing them on how these procedures are performed. And this is done very easily in the United States. There are a lot of Da Vinci labs where physicians will go, they will watch a video, and then they go right down to the lab and they practice in it. But that's the advanced level. But for most medical consultations, you can reach a lot of the decision making via these very easily available and handy platforms that everybody has. But the institutions themselves will have to have advanced systems to allow them to communicate appropriately and store data. They'll have to have a very good health information system, electronic medical records, because you need the data to be able to follow up as to the outcomes of the treatment.
Tony, any thoughts, any quick thoughts you want to share on that as well?
Yes. Now, apart from what Prof said, we should also remember that we want to look at provision of basic healthcare, and not only acute, but also health information. Probably in my area, looking at things like maternal mortality rates, which is one of the goals of the United Nations Sustainable Development Goals. Ghana has done very well in reducing our maternal mortality. We've halved it in the last 12 years, from about 600 deaths per 100,000 live births to about 300. And that the same has gone for reducing our neonatal mortality rates and for under 5 mortality rates. These have been done using traditional approaches, healthcare approaches. I think we have done as much as we can. Using telemedicine and telehealth platforms, most of these interventions have been done in rural areas. A woman in urban areas, a woman in a rural area is 3 times more likely to die than a woman in an urban area. By now focusing, using telehealth platforms to get messages out into the community, into the rural areas and remote areas, that is very simple messages about just safe birthing methods, about reducing how to easily manage hemorrhage, which is one of the leading causes. We can further reduce our maternal mortality rates from 300, where it is now, to the Sustainable Development Goal of 70 per 100,000 women. And that goes with all the other indices of the goals which Ghana is trying to achieve, or Ghana will achieve if we plan properly. So that would be my take on it. Using these just to get low-hanging fruit, simple fruit, which need simple, low-cost solutions. And as Prof said, the store and send, using unidirectional SMS messages, WhatsApp messages, emails, yeah.
We had an interesting question that just came in on email. There's a comment that, obviously with the increasing usage of telemedicine globally, and especially in Ghana and other parts of Africa as well, it creates some vulnerabilities in the system. People who are, it gives an opportunity or a platform for people who are criminals or fraudsters who are looking to potentially peddle bad medical advice, sell bad medications to unknowing populations, and then profit from this whole exercise. What sort of advice can we give to the public on how to avoid such outcomes? And maybe Tony, you can take that one. Fake medications, fake health advice, things that basically lead to really bad consequences for the public.
Okay. Yeah, I mean, that is already inherent because around the world, everybody knows about WhatsApp being used as a platform for fake news, not only for general issues, but also for medical issues, especially with COVID. How many different types of concoctions and measures did any of us ever come across? And most of them were totally false and dangerous. It would be difficult to stop with the liberties we get with WhatsApp, with anybody could use the platform to be able to stop it completely. But if we have official public messages which everybody trusts, people are going to be more likely to incline towards using these platforms and ignoring the non-official platforms which currently are, people, most herbalists and other people tend to use at this present time. So it's about setting up official channels and getting people to trust them and use them.
Yeah, what I will add is that, it's like direct to consumer advertising, whereby a company says this medication is such and such and such, but at the end they say consult your doctor. Okay, it may not happen here, but that can easily be an avenue where infiltrators can come into the system. But I think if there is a good public service announcement and general education, public health education carried forward throughout the country, people can be made aware of what information is good or bad. So the information can be censored. We can also have certified data say that individuals should not take advice from other individuals. It has to come from a legitimate source. So if you have teleconsulting centers in the sub-districts, a patient can only take the advice of a physician, and everyone should be assigned maybe a personal physician so you know who the message is coming from. So it's a matter of organization and making sure that we try to avoid the kind of direct-to-consumer advertising or information sharing program that is rampant in other parts of the world. But it certainly is a threat, but with proper strategy and policy laid out, it can be overcome.
So I think we're approaching the end of our allotted time slot here. So I'll throw out one final question for both of you, and it's probably a little bit broader than telehealth. The government has announced a pretty ambitious plan to build up to 88 new hospitals all over the country, targeting many, many districts as a way to boost our infrastructure and capacity on the back of COVID to be able to deliver better healthcare. Any thoughts on that? If you had an opportunity to give some advice as to how this should be shaped, what would you say? What would you advise?
It's an ambitious program. The question is who are going to be the individuals running the institution with the death of physicians in the country. We're basically going to be sort of moving physicians from one location to another to the point where physicians will be serving 3, 4, 5 hospitals. But I think it has to be done hand in hand. The manpower development program has to occur at the same time as we are developing infrastructure. We may not be able to develop physicians at the same speed, train them at the same speed with the experience and the proficiency as you're building an institution. You can build an institution in a year, but it takes 10 years to really train a specialist. So the plan has to start now so that 5 years from now, when these institutions are all built, that the requisite manpower is available. But whilst we're doing that, this is where telemedicine can play a role. If the proper technology is put in place at these institutions such that these teleconsulting health centers are present, that can be tapped into by physicians at different distances. So even Kolebu physicians can take a day to do teleconsulting for specific institutions. So let's say we have sub-district ABC, and there are no general surgeons, there are no OBG, there are no infectious disease, plastic, or cardiology. At least a clinic can occur via teleconsulting once a week to an institution by a specialist in Kolebu. The same thing can be done by a diaspora physician specialist also. But then as an investment should be made into establishing very strong teleconsulting infrastructure in these institutions, tapping into the distant specialists in the country and outside until we are able to produce them on the ground.
Tony, final word?
Yes, final word. Yes, adding to Prof's, just expanding on the lack of resource. Prof mentioned it earlier on in one of his answers, talking about the use of nurse practitioners and nurses and physician assistants. It's going to be difficult, if not impossible, to staff these 77 new district hospitals and maintain the staffing. So it's about, it is easier and quicker to train nurse practitioners, easier and quicker to train physician assistants whose level is about that of a junior doctor. Now, with these people manning sort of the more remote areas, support can be given by using telemedicine platforms and telehealth platforms very, very easily. That's one. Two, my concern about that would be about identifying funding for sustaining these hospitals, because it does cost a bit for ongoing sustainability of these hospitals, which may impact on provision of healthcare, elsewhere. But if this is going to go along, and is Nana's wish that it goes along, then it is crucially important that in each of these district hospitals, tele-center is established, which it doesn't matter how complex it is, it could be simple solutions, but from which support can be given to these district hospitals, especially those where they don't have a resident doctors.
Okay, great. Well, thank you both for those very insightful remarks. I think, first of all, we appreciate your time. Both of you are very busy having schedules with surgery and so on and so forth. So we appreciate you taking the time to join us to do this panel today. I think your comments are very insightful, and I think Ghana is very lucky to have practitioners of your caliber thinking about these issues and thinking about how to take us forward. And hopefully we can make some practical progress and achieve some of the low-hanging fruit you have all laid out as we look to beef up our telehealth presence. So thank you again. So Jerry, I'll turn it back to you.
And a grateful nation says thank you to you, Yaw Samoa, Director of Focus, together with Professor Ohiniba Boatie and Dr. Tony Borrett, for those very insightful views. They've been very frank and straight to the point. A few takeaways for me: it's an investment that we need to do. We need to really consider the financial outlay, the infrastructure required to execute this. Privacy of data is something very key. But while we wait, why don't we invest in some innovative approaches to training the healthcare professionals that remain to serve? And one other thing that comes to the fore is partnerships and linkages. While talking about partnerships and linkages, is worth noting government's great strides in the area of healthcare delivery by way of using drones. If you know of the Zipline Distribution Center, drones have been deployed to deliver medical supplies anywhere in Ghana within 80 kilometers or 50 miles of a Zipline Distribution Center in 45 minutes. 4 of these centers have been built so far, and they've served over 2,000 clients. I believe this is timely, and the government of Ghana is really living up to the expectation. Our next session really delves into the private sector and how they can lead in the recovery of Ghana out of this pandemic. We are supposed to go for a little break lasting not more than an hour. We shall return at 3 o'clock exactly for this very insightful conversation. Why don't you grab some coffee, have some lunch, but please don't get too indoors, else you may fall asleep. We'll see you at exactly 3 o'clock. Time check is exactly 3 o'clock, and it's day 2 of the Accra SDG Investment Fair, organized by the Ministry of Finance, the Ministry of Planning, the Ghana Investment Promotion Center, and the SDG Advisory Unit. We welcome you back, all our panelists and all our participants. Just gone by was the first panel on telehealth and telemedicine. It was moderated by Mr. Yawa Samoa, Director of Focus, together with Professor Ohineba Boachieje and Dr. Tony Burt. We now delve into the second panel for today. The discussion will be about a private sector-led COVID-19 recovery scenario. The moderator is the founder and of Social Enterprise Ghana, I beg your pardon, Madam Amalate, and she'll be hosting Mr. Edem Seshi. He is associate partner at McKinsey. Ama, if you're ready, please take it away.
So welcome everyone to this panel on a private sector-led COVID-19 response. COVID-19 has been one of the most defining incidents of our era. And one of the things that it has resulted in is a lot of partnership between the public sector and the private sector, a lot of innovation by companies as they face existential risks to their operations, and many businesses are having to reinvent themselves. As the crisis begins to get to a climax, the conversation now is about recovery and what that means. What does that mean for a business that has been hard hit, or for a business that has been able to evolve and is now looking at long-term resilience and growth? What does that mean for somebody in the public sector who is thinking about policies that will result in bringing the economy back to life? And to help us with this, we have some interesting guests who have done a lot of support to both private sector entities and public sector entities in these times. I'll let them introduce themselves. And so starting off with our first panelist I'd like you to introduce yourself, and in your introduction, give us one example of something that has been done by either a business or government or an industry association that inspires you because you think that it sets them on a great path to recovery and to being part of that positive private sector-led COVID-19 recovery scenario.
Thank you very much, Alma. My name is Adam Seshi. I'm a Ghanaian and a junior partner with McKinsey based in Accra. I do most of my work with financial institutions and a number of topics, and also work a lot in public sector with public finance and economic development. I focus most of my work in financial institutions actually on the payment space, and also just helping financial institutions think about business models for retail, both in consumer and for small and medium scale enterprises. I think the thing that excites me the most, or the greatest example that I see, and perhaps I am biased because I love payments, is all the innovation that we are seeing in the electronic payments and e-commerce sector. And I particularly love it because it has both a human angle to it and a shrewd commercial angle to it, right? I say human because in some ways you've seen that fees have been completely eliminated or drastically reduced, especially for small businesses. And some processes have been dramatically simplified. It's much easier now to get yourself into the payments, to a payments platform or e-commerce platform than it was pre-COVID, right? I think what this has done is it's made it really easy for a lot of small businesses to get onto e-commerce and to get onto payments. If you look at what Paystack is doing in Nigeria, or if you look at what DPO and MasterCard have done in Kenya in helping small businesses create their own online storefronts, these are all very great examples of a complicated process that's been made very easy for small businesses. Now, what this means is that these guys are building a large group of new customers, right? And while this may not produce immediate commercial opportunities, what that means is that coming out of COVID, they are now on a very different accelerated growth trajectory because you've suddenly essentially doubled your customer base in a matter of 3 to 4 months, right? So that's really what excites me. I also think we should give some credit to public sector along the same dimensions. Even if it hasn't been as equally successful as the private sector, right? I think a great example is Ghana's own universal QR code, right? And the waiver of fees on these types of transactions, etc. So generally, there's been a lot of progress in that payments and e-commerce space as a result of COVID that I am excited about.
Thank you, Adam, for sharing that. It's good to have these examples that inspire us. But I'd like us to break it down and make it really practical for a business. Say you are in the hospitality industry, that's been really hard hit by this crisis, and simply setting up an online front may not bring back the kind of revenue that they've lost. So if there's a business that wants to not just build resilience, but seize opportunities getting to the end of this year and entering 2021, what should they be doing? What should they be doing immediately? What should they be doing over the next 18 months to make sure that they thrive, they grow, and they're able to recover?
Yeah, I think this is a fantastic question, not an easy one to answer, but again, there are some things we've seen here, right? Or things we've said over and over again, but now there are examples of people that are actually taking the lead and doing it. Particularly this old line around, reinvent, adapt your business model, or be creative, right? Take advantage of opportunities. What does that really mean? I'll take two examples, right? One is in the space of tourism, which has been really hard hit. I was really excited to see on TV the other day about how a team of tour guides in South Africa have actually virtualized the entire tourist experience with some cameras on the back of a Jeep driving through the same places that the tourists would have driven through. And essentially, having the tourists live participate in it with some of the stuff that makes the experience as close as possible to being on the game track, right? Now, that's not the same thing has been on a game track and probably doesn't have the same level of patronage as being on a game track, but clearly they're doing something and they're making some revenue with the customers that signed up to that, right? Another great example of adaptation, right, of adapting a business model is the bike hailing space in Nigeria, right? Now, you have businesses like GoKada that I'm sure most of you have heard about. There's also like Max NG, it's like All-Right. Even before COVID, these guys were already hit by a regulation that essentially pushed this business to the fringes of Lagos, where it's not really the place you want to do that business, and you really designed this business for the heart of Lagos, right? So these guys were already adjusting to that regulatory hit, and then came COVID, which actually then collapsed demand, right? So at first you had like a regulatory hurdle to deal with, but demand was still there even though you couldn't service it. But what COVID actually did was just to destroy demand, right? So what did these guys do? Different reactions. You saw Max.ng and GoKada realizing that, wait a minute, while consumer demand has collapsed, all this demand that has moved to online and e-commerce means that a lot of businesses now need delivery services that need the same bikes. So what are we going to do? We're just going to put boxes behind all these bikes and go into B2B and shift away from bike hailing to delivery services, right? So that's what GoKada and Max NG did, for instance. On the other hand, you see All-Right completely retreat from the business. But in that retreat, there's actually something to learn, right, about how to take advantage of growth and or find growth opportunities and build resilience. What All-Right did was to retreat to what you would call the area of strength. Because what they had also been building in this, they were building an ecosystem. So they also had a bit of a payments play that was a very much offline payment-driven business that now took off because of COVID, but it was already growing very fast because of it. So one thing they did is one thing that everyone needs to do, which is preserve capital, right? So rather than deploying capital all over the place, they retreated all the capital to focus on the one thing that they realized they had a competitive advantage in, which is the payments business that was, taking off like wildfire in some parts of the country that even mobile money had difficulties reaching, right? Now, the thing to keep in mind is that what allowed them to do that was that they had diversified prior to COVID, and so they could retreat to an area where there was still growth if they believed that, some other part of the business was badly hit. So I think those two things, right? Those are two great examples of one, what it really means to adapt your business model, right, and think creatively about responding to changes in environments. And the other thing about then having, which is really a growth thing, right? This is not really about just surviving, that's growth. Then there's the other thing about actually surviving, which is you need to be really smart about where you put your capital, the very little capital that you have, right? And make sure that it's focused on an area where you truly believe that you have an edge to compete. I think finally, there's the other thing is that you need to build partnerships in this area, but we'll talk more about that later.
Great. Thank you, Adam, for that. I think that's really clear. Just thinking about it, you're talking about innovation, you're talking about being realistic, saving capital, and preparing for the future growth, focusing on the places where you are sure that you're going to have growth and you'll be able to operate.
Absolutely.
I know we have a number of people from the public sector in the audience. They are working on policies to drive business resilience. When you think about the businesses you work with and you consult with, what are some of the things that public sector needs to keep in mind? What do they need to be doing immediately and over the next 18 months to ensure that businesses continue to be resilient and to grow? I know in Ghana, there have been a number of policies reducing, giving extension on tax payments, reducing the rates, the interest rates, and a few other policies that were meant to cushion businesses and give them a little breathing space to be able to withstand the lockdown period and then relaunch themselves. What else could government be doing, and what do policymakers need to keep in mind?
Fantastic. I think one, it's in order to acknowledge, the breadth of the interventions that have been put in place, especially in our economies where we do not have a lot of bandwidth in terms of revenues or excess funds, to be able to do some of the very sprawling things that places like the US and then Europe are able to do, right? So it's a very, challenging territory to navigate for our governments, and impressive to see that in the midst of all that challenges, the right type of prioritization has been done to put a lot more capital towards small businesses. I think one more thing that could be done, though, is to think of the entire economy as a business that is competing in a global place of businesses, and to ask the question, how do we actually make the entire economy itself competitive, right? And what do I mean by that, right? So I think if you take, there are certain things like capital controls, your exchange rate controls, etc., things that Ghana actually does quite well on. But then you think also about taxes, and about import taxes, about export duties and things like that. And you need to be asking yourself, on a global scale, am I being competitive, right? I'll give you a very practical example on e-commerce, for instance, right? So I know someone who imports, for instance, a rice processing plant in Ghana and pays a tax that is somewhere in the region of 45%, right? Now, if you think of this person as a Ghanaian, they don't have much of an option because they want that plant in Ghana, and so they're going to pay the tax. But if you start to think about someone who is operating in a global marketplace and it's a business or an investor, they're not bringing that machinery to Ghana. And that's a machinery piece of equipment that Ghana actually really needs in a lot of quantity. So you wonder why you should be paying 45% tax on something you don't make locally but do need, right? Another example, for instance, is also just what do we need to do to strengthen some very specific components of the things that make businesses successful, like the supply chains, the infrastructure that delivers the supply chains, and why you can't go around the entire country and build an entire new network of roads. It's critical to identify what areas that infrastructure is particularly critical to, right? I'll give you an example. If I need to buy something from Amazon, for instance, I now route it through to Nigeria and then I bring it to Ghana because I ordered books to be delivered to Accra last year and they haven't arrived. Right? On the flip side, I know a friend who ordered a dress and then had to pay a duty of about 50%. And while everyone else was telling her that actually that tax is illegal, the process of getting to pay the right tax, which should be zero because it was a personal good, was so long that it was more convenient to pay the tax, right? Now, that's not a great thing if you start to say that just between Ghana and Nigeria alone, Nigeria is more competitive than Ghana for businesses that are selling on Amazon, for instance. That's not a great thing, right? So I think beyond being able to support local businesses to build internal resilience for the internal economy, etc., you need to think about the economy itself as a business that's competing for scarce capital in a global marketplace. What are you doing to position that business to have an edge?
Thank you for sharing that, Adam. You talked about what businesses could do. You've talked about what governments could do, remain competitive, don't have nuisance taxes, etc. One of the things we've seen in this pandemic is a lot of partnership between the private sector and the public sector. In areas like in Ghana, for example, private sector, public sector came together to build hospitals. We found that various industries, the banking sector, partnering with the Bank of Ghana to come up with policies that could help their customers who are SMEs to thrive, to create products that were purpose fit for a crisis like that, giving people moratoriums, adjustment in interest rates, adjustment in facilities so that businesses would not close down. How do we sustain some of this to fuel a stronger economy? I mean, how do businesses, business associations that are supposed to engage government and advocate on behalf of their members, etc. How do they continue to ensure that effective partnerships that result in some of these actions continue?
Fantastic question, Amma. I think one thing this COVID-19 has demonstrated was that we always had the capacity to build deep and meaningful partnerships that actually deliver results. We just were never deliberate about it. But COVID forced us to react to a certain circumstance. Now, the question is, how do we move from this reaction to be a bit more deliberate about the things that the public sector and the private sector could actually do together on an ongoing basis, right? I think I like to throw the challenge back to private sector. And again, this is probably a bias of mine. I just do believe that the interests of business are much more stable and predictable than those of government. So it would make a lot more sense for business to have a clear agenda that they push consistently, regardless of what the structure or nature or character or priorities of government are, to make sure that those things are happening, right? Which means that it's up to businesses and business associations to be very clear what do we want from government, right? And to go and push that. A question I always ask business is, are you clear what you need from government? Do you have a list of 2-3 demands, or do you have your own manifesto of 150 pages that if I finish reading, I won't be clear exactly what you need from government? Like, do you actually have a clear agenda of what you want from government, and what are those 2 or 3 things? Number 2, how are you organizing yourself as a constituency to go and push for those things to be done? Because a lot of these organizations will meet and talk about the dues, the funeral of the member who died, etc. But it's important to have not just a clear agenda of what you want, but a clear strategy for how you're going to engage government, what part of government we're going to go and engage, because like I always say, there's no one whose name is government, right? So once you figure out what it is that you want from government, how do you engage? Who will you engage in? What's the body? What's the institution that you're engaging? And how are you going to actually then go ahead and engage them? In other parts of the world, the US, UK, etc., they call this lobbying. And it's a key and core activity of business associations. And you should literally think of yourself as a constituency that needs to be appealed to be moved, and who moves in a direction, or that can only be moved in a direction that works for your interests. So I think for me, that's a key thing for businesses and associations to be very clear what they want and have a clear strategy for who to engage, who specifically to engage to have those policies, those interventions come to pass. What it also means is that businesses need to be able to organize themselves into these constituencies that are large enough that you cannot ignore them, right? That are large enough that they can actually make demands that force those who are in charge of policy to listen. You know, I always say students don't pay taxes, don't contribute money to any political party, but the political parties are always there trying to win students because they're a clear, delineable constituency and they are large, right? That's the key thing, is for businesses to be able to congregate themselves into constituencies that are large enough that they force you to listen. And for those large enough groups to have a clear agenda of what they want for government and to push those things consistently from year to year, regardless of what government looks like.
Thank you for sharing that perspective, Adam. As someone who leads a business association, a lot of that hits home. We've done quite a bit of advocacy. We have a plan, but I think there's a lot more that we could do in making sure that we're more focused and that we're able to deliver clear actions that can help the businesses that we support. In my case, they are social enterprises. And so these are businesses, but they also deliver a good or a service that has social or environmental impact. One of the things that businesses, even government, is grappling with is how to finance this recovery. You can reserve cash if you have some, by closing down business. You can innovate and get into a new line of business or an adjacent business that can fuel your growth. But whatever it is you do, you still have to finance it. Mm-hmm. What innovations are you seeing that could inspire any of the businesses in the room to explore all the financing options that are available to them? And what are there any new innovations, or even with the traditional financing categories or products that are on the market, how does a person position themselves to make sure that they can finance this recovery?
Fantastic question, Amma. And it's very much linked to the partnership question. And I think one thing to make clear is I'm trying to focus on what I believe is like top of the list, right? Versus being comprehensive, because what are all the things you could do, and then focus on what are the most important things you could do. Now, this issue of finance, it's not really about innovation because it's a problem that is older than COVID, right? It's about being deliberate and doing the things that we always knew needed to be done. Now, in finance, one thing is clear: bigger is better. What does that mean? Guinness, let's say Guinness will be able to access much more funding at a lower cost than Casa Preco. And Casa Preco will be able to access much more funding at a lower cost than Pokeke. Why? Size. Now, when you're a small business, how do you mimic the advantages of size? You need to band together and start to behave like a big business than insisting on remaining a small business with your risk profile and then trying to access low-cost funding with nothing really having changed about your structure. Because what it means is that you actually do not understand the way the supply of the commodity called finance that you're looking for works. It's not about your specific dislike for your business. It's just, I'm sure Casa Preco also wishes that it could be able to raise Eurobonds at 2-3% or some of these ridiculous rates that the likes of Guinness are able to attract, but that's not what it is. Nor can you, if you're the manufacturer of Pokeke or distilling 2 or 3 bottles of palm wine in a village, should you expect to be able to attract funding at the rates of Casa Preco? Now, this is also not rocket science. This idea of small businesses banding together, it works like magic in Kenya. If you think about KTDA, the Kenya Tea Development Authority, and contrast that with, say, Cocoa Board, for instance. The Kenya Tea Development Authority is actually a privately owned thing that is owned by 600,000 tea farmers, small farmers. Now, they've been able to aggregate themselves into this thing that is so large that no one thinks of it as 600,000 farmers. It's so big that it actually has its own insurance subsidiary that tailors insurance products that are specific to the needs of tea farmers. It's big enough that they have the capability to develop new export markets and opportunities, and as an institution to learn the advances in tea growing technology, etc., that are required, and pass that down to the 600,000 farmers who do not have the capability on their individual selves to go and become experts in all the technologies of tea farmers and send the extension officers, etc. This is not organized by the government. This is the farmers getting together and creating an association that is large enough that it starts to behave like a small business. Now, when I drive down the Accra Flower Road and I see all these farmers with their, watermelons and tomatoes parked by the roadside, I just wonder, are they waiting for governments to come and constitute them? Are they waiting for a bank to come and finance this watermelon by the roadside? That can't be the plan, right? Because even I wouldn't finance a business that's relying on being able to sell watermelons by the roadside that will probably dry or go bad in another week or 2, right? So this thing about banding together, forming new partnerships that are based within the value chain, private sector, constituting yourself into a body or a constituency that is large enough that whether you're talking about finance or policy direction, you're large enough to push it, right? I think the other one is for every small business to invest in educating yourselves about the opportunities that are actually out there, right? I was in another webinar the other day that was organized by the African Union that is launching an Africa-wide academy, different topics, let me not go into it. But on that webinar, there was about 400, this is in Ghana, by the way, there was about 400 small businesses. There was some gentlemen from the central bank, the lady who runs the National Board for Small Scale Industries, there was people from Fidelity Bank, Echo Bank, etc. And they were talking about all the opportunities that are available to small businesses. Now, it was great and refreshing to see some businesses, posting on the webinar, in the chats about all the finance opportunities that they got, some the COVID intervention fund from government, and how those have been very helpful to them. But there was also a large number of businesses that were now asking, how do I apply? Right? So if you're one of those businesses, this isn't really about rocket science or how do you innovate. It's about just go and get yourself educated about the opportunities that are out there. There's all sorts of funds and NGOs that are looking for small businesses that are doing something meaningful, women entrepreneurs, youth entrepreneurs, etc. This MasterCard Foundation looking for all sorts of things to finance. Just get yourself educated on what these opportunities are and go and take advantage of them. Right? And then finally, I'd say also take advantage of some of these modern trends and the product offerings that are coming with them that are a little different from go and fill a form in a bank where they'll ask you for collateral information you do not have. And some of these are like the e-commerce and not traditional opportunities. On that same webinar, I had Fidelity Bank and Echo Bank talk about these merchant credits that are available to traders and sellers who take payment either through some POS or some electronic channel, and that your transaction history automatically qualifies you to a certain quantum of funding that has nothing to do with collaterals and all these traditional forms of financing, right? And that's immediately available. And this is probably the most demanded type of financing that traders are looking for, which is inventory financing. And here is an opportunity for you to access it, but you're probably sitting in front of your stall in Makola and selling 100% of your produce in cash and asking to be financed. And then when they ask you to fill the forms, etc., you don't like it, but you haven't taken any step to help yourself, right? So I think for me, those are the three things. One is band together. Small businesses need to band together and mimic larger enterprises because then you're able to access cheaper financing and all that stuff, but you can also lobby and you can also help yourselves. Two is educate yourself about the opportunities, and three, have a sense for where modern financing is going and plug into it.
Thank you, Adam, for that synthesis. We're running out of time, so I have a closing question for you. And this one is more forward-looking. I want you to play soothsayer or prophet. Look into the future and imagine the best possible scenario. A world where we've recovered from COVID-19 and businesses are growing. And tell us, in that best case scenario, prediction for strong recovery, what opportunities do you see in this world? What do you see in this world, especially for businesses, but you can also throw in something for the public sector or academia or any other group, and give us your prediction of that positive post-COVID-19 recovery scenario.
I'm not much of a prophet, but again, I'll go with my biases. I'll go with my biases. I think post-COVID, we've made a lot of investment in some infrastructure. Mobile money has taken off very well. It's now one of the most widely used forms of payment in Ghana. We have some good internet infrastructure. We have some public investments in things like the national ID, the universal QR codes, public procurement short codes, and all of these things. I think post-COVID, I would like to see all of these things come together and integrate into a really rich ecosystem and mature so that Ghana will sort of be the Estonia of Africa, where things like, if I take my national ID, for instance, all the use cases are fully explored, right? So for instance, I shouldn't be going to get another voter ID card in 2020 and queuing in COVID for a voter ID card when I have a national ID that has a chip and apparently is able to deploy 18 use cases. Why isn't one of those a voter's ID card, and what are we waiting for to actualize that? Right? I think number two is I would love to also then see in this ecosystem, our businesses get a lot more bolder and more creative and take advantage of these opportunities, right? One thing I always say is every year, the government buys a huge amount of cocoa from a whole bunch of farmers. The payment mechanism has remained the same. This cash delivered through these buying companies. Where is a private sector leader who's going to take this on and decide to digitize that entire thing and create a business for themselves, right? Versus trying to broker electricity bills that everyone else is competing for, right? So I think for me, that's the future I imagine. I really want to see all these investments mature and come together and form a really rich digital ecosystem and make Ghana the Estonia of Africa. And I really want to see our private sector players step up and solve homegrown Ghanaian problems that are already large and represent an area of opportunity.
Thank you, Adam, so much. That's a world that I'm looking forward to and hope that we'll participate in it together. And that brings us to the end of this part of the conversation. We're going to open it up and take some questions for those of you who are on the line.
Thank you very much, Ahmad.
For me, it'd be help, and I'm just trying to get my mind around. We kind of got three things, right? We got this grant to get up and running, so we get some staff on and helping iterate on these questions. We have what is the central ATA look like? And then we have what's the actual ATA in the country look like?
I hope you can hear me. I can hear one person asking a question. If you can just hold on a second. And thank you all for listening to that. As you can guess, because my hairstyle and jacket have changed, that was a pre-recorded session. And we pre-recorded to make sure that we would not have any issues with the technology. But this Q&A is live. And I'm delighted to have Adam, who was the panelist, but also Amandla, who was our second panelist, but who was not on the call. And so Amandla, I'd like to kick off by asking you to introduce yourself. And as you introduce yourself, tell us a bit more about an example of an initiative by private sector, business, government, or others that inspires you, that points to this private sector-led COVID-19. We also have a poll that is showing on the screen, and that is, the poll is giving us a sense of who's in the room. So I can see 24% of us are from government, 24% are entrepreneurs, and the rest are a mixture: investors, civil society, and some community facilitators, knowledge institutions, etc. So Amandla and Eden will think about the audience as they answer these questions and make sure that their answers are relevant to you. So straight to you, Amandla, to introduce yourself. Amandla, I can see your profile, but we can't hear you.
Hi, Emma. Can you hear me?
There you are. Yes, we can hear you now.
You can hear me now?
Yes.
Wonderful. It's a pleasure to see you all. Just having some tech troubles getting the audio connected. My name is Amandla Okombaka. I'm an associate partner in the Nairobi office of McKinsey. I lead a lot of our public sector agriculture work in the region. I do all my work in agriculture and food, and I've had the immense privilege of spending a good amount of time in Ghana, actually working on issues of tax as well as issues of agriculture.
Thank you. So the first question is there any initiative that inspires you that you could share with us? It could be something done by private sector or by government or by business association, but that points to a strong private sector-led COVID-19 recovery or post-COVID growth. Amanda, we lost you again. The voice somehow is.
We probably have a.
You're back.
Perfect. Now something happens every time I mute, so you don't get my background noise. So I'm biased. I will bring an example from East Africa in the spirits of learning and providing some additional examples to what my colleague Eden had shared in his video. I was recently part of the Ministry of Agriculture Food Security War Room in Kenya. And the objective actually during the COVID period was first and foremost actually to prevent any food crisis due to the result of shortage of food, people having not as much income because of not being employed, but other issues because particularly in the agriculture sector, COVID did slow down growth, but we had a lot of headwinds actually in the agricultural sector before COVID. So we were fighting things like locusts in this part of the world. What I found particularly inspiring about that setup of the Food Security War Room is how many other stakeholders came to the table to provide data for action. So there were over 60 stakeholders in the private sector and development partners that the Ministry of Agriculture brought together to answer questions from as basic as there's a truck stuck at this border and cannot get through despite having an essential path. Who in this room is closest to the truck? It turns out it's a private sector player. That's a food retailer that has an outpost there. So they can actually go and figure out what truck is stuck where, right? Or things like prices. We're getting conflicting information on the price of maize meal in any given point in time. Who from the private sector, public sector is closest to the ground and the data to provide that? And I found that really, really inspiring because we struggle with data in agriculture in general, particularly during times of emergency. You need to know where things are in order to make decisions. So people coming together, people saying, look, yes, there are questions of intellectual property and data sharing. We understand that, but we need to avoid a food crisis. So let me share my data with you so we can all find a way forward. I found that particularly inspiring, and I hope that that sort of bringing together data from various stakeholders will be something that will help us get out of the crisis and find ways to be more data-driven in our decision-making going forward.
Thank you for sharing that, Amandla, and it connects with Adam's point about us collaborating, coming together to form bigger entities, about coming together to share information so that we can have responses that are more effective. My last question to you before we go to the Q&A, we have a few questions that have come through by email and a few in the chat. But my last question to you is, when you look into the future and you look at, I'll ask you to play prophet also, and you think about what a strong private sector-led COVID-19 growth scenario looks like in Africa, what are some of the things you see? What opportunities do you see that businesses in the room, government officials could begin to prepare to make sure that future dream actually becomes a reality?
Yeah, so my pastor would tell you I have no prophesying powers. So let me try and share from a recent report we did. I'll put the link in the chat window. What are some of the trends that we think are going to reimagine and reshape our economies going forward? As I mentioned before COVID, there were a lot of issues we were dealing with as a continent and businesses. So let me try and get a bit specific onto what these three ideas would be. If I was a big business or investor, which I'm not, I would look towards the competitiveness of our sectors. We're going to see, and have already started to see, a lot of consolidation. When I think about things like the airline industry, right? If you draw an axis here, if you think about the state of disruption of COVID on the y-axis, so airlines completely shut down versus agriculture, essential services had to keep going. And then on the x-axis, just think about the type of disruption that happened to the business. So are people having to change their products? Are they having to change their pricing model, right? We're going to see a lot of consolidation. And the risk appetite for global players to invest in Africa is actually lower now than we've seen it in the past 4 or 5 years. So if I was looking to make an acquisition or make a divestment, depending on the industry, I think this is a good time to do that. We will be driving the consolidation across most of the sectors that have really suffered from COVID, hotels, tourism. But I think we also have an opportunity as we think about innovation for the sectors like the one I spent a lot of time in agriculture. It's a question about really how do we bounce back fast. So in Kenya, and I think it's a similar case we've seen in Ghana as well, where there's a lot of fruit and veg that's actually exported, or in Ghana's case, cocoa. How do we make sure that the shortening supply chains are actually something we lean into, right? The fact that we don't have as much logistics freedom to move. So that's the first one. The second one I would think about is actually on manufacturing. So I'll continue there. Currently, 40% of every dollar of manufactured product in Africa is imported. So it means that there's 40% of inputs we're just getting from somewhere else. Again, I don't think that's a tenable future. We've shown some bright spots on things like PPEs, for example, which are very, very small, but we've shown the ability to very quickly localize supply chains there. When I think about food, I always bring up this example in your neighboring Nigeria, right? For all the jollof rice that's eaten in Nigeria, I am a fan of Ghanaian jollof, let me say that, and Senegalese jollof as well. But there is no commercial production of tomatoes in Nigeria. And so we need to fix some of these supply chain issues in manufacturing so we can bring down that proportion. If you're interested in manufacturing, I think it's a really good time to lean forward. And then the final thing, I always like to say that the informal economy is the economy in Africa, right? We can survive the demise of one or two big businesses. I would not wish that upon anybody, but the economy will survive. If the informal sector collapses, we're in real trouble. So I think for me, it's what ideas are going to catalyze a formalization of our SMEs. When I think about companies like Google and what they're trying to do, bringing Google Suites to businesses and SMEs, really, what does a business suite of management tools look like? That to me is really exciting from a private sector angle, but also from governments, because if we formalize these SMEs and we make people pay taxes, we have to give services back to them. So those are the three areas I would look at, right? This consolidation, M&A, particularly in the sectors that we know are going to be fundamentally reshaped. Manufacturing, so we can actually manufacture a lot of the inputs that we then, we can grow a lot of the inputs that we then manufacture. And then finally, this catalyzation of SME formalization.
Thank you for sharing those. Lots of opportunities for those on the line. Go out to buy a business. If you have the resources, think about localizing supply chains, manufacturing, and look at formalizing the informal sector and what you can supply there. We're going to jump into the Q&A, and we have a number of questions. The first one I'm going to ask to Edem. The question is, in order for effective partnerships between government and the private sector to build back better, how should the private sector position themselves to attract effective collaboration that leads to recovery? You touched on this in your submission. You talked about having a clear focus of a few things that are consistent so that private sector associations can push government. And you talked about coming together. But is there anything else in hindsight that you would add around how government and private sector can partner effectively? Maybe this time thinking from the side of government, since we have 25% of our audience from government. Edem, you're muted.
I think he's having the same problem I had. Okay. There we go.
Thank you. This thing is very high tech. It doesn't allow you to unmute yourself. So my very analog computer was struggling. So honestly, I don't want to dilute the message, right? I think the only thing I would add is I was in a session the other time where someone I respect very much, Ngozi Okonji, well, I hope I haven't butchered the name, was speaking, right? And I think she summarized what I was trying to say in a sentence that I would just quote, right? She said, the more you can aggregate your voice, right? And she was asked a question about government, what government can do, etc. And she completely backed away from that and said, spoke to businesses and said, the more you can aggregate your voice, the more you reduce the risk of becoming a single enemy of government, and the more you can act as industries and industry players, the more you can influence policy and do things, right? So I think honestly that is really the long and the short of it, right?
Thank you, Adam. That was very succinct and very inspiring. Our next question I'll give to Amandla. It's someone is asking, what are the challenges that they could face bouncing back? And again, what could government do to support businesses? We talked a little bit about some of them in the recording. We talked about access to capital, cash flow, and Adam talked about making the economy as a whole attractive, not just for local businesses, but for all businesses, so that it's a resilient economy. But are there other things that a government could do on a structural level that could help private sector bounce back better?
Yes, so I would not underplay at least the first of those challenges about access to finance and access to financing. So if we go back to this trend of SMEs, so 70 to 80% of businesses across the continent are SMEs. They're providing more than 60% of employment. It turns out half of them are in Nigeria, according to our most recent analysis. And then, between Kenya and Ghana and Tanzania, you get to the next 25%, and then it's quite a long tail at the end. So identifying who these SMEs are and identifying how to target them with financial access that makes sense is, I think, the number one challenge people are going to face. What we've seen in the ag space, where I spend a lot of my time, we know who the big fertilizer players are, the Olams of this world, the ETGs, and they know who their agro dealers are. So if we're going to try and provide access to finance to agro dealers, the government is actually, it's much harder when you're not all registered like they do in India. They have the Aadhaar system where every single SME is registered, but in our case, you don't have that. I think trying to find a way to get the financial access to larger players in the value chain who then know who the SMEs are is really important. And there are many more ideas we can talk about there if people have questions. I think the second challenge I would mention and what government can do is actually just on communication. We have become so accustomed to a high level of data-driven communication from our leaders through this crisis. It's been phenomenal, just the level of communication we've seen from South Africa to what you're seeing in Ghana with your president and the Minister of Finance. We need to continue having that level of transparency and communication, particularly on policy changes going forward. So I think that is a really big constraint. If one day the tax rate is this, the next day it's something else, right? If one day this is an essential service, the next day it's not, that disruption can be really, really challenging for businesses. So I think maintaining transparency and communication, particularly around policy, is probably the second challenge, but I think government is actually in a good place to try and solve. And then the third thing I actually think, which worries me enormously, is when I think about things like education, right? When I think about particularly education of the girl child and what has happened during the crisis, I worry about the talent that we'll have going into these jobs in 2-3 years, right? Because you're out of school for one semester, maybe you go back. You're out of school for 2 semesters, the likelihood that you go back diminishes by 60 to 70%. And I don't think that's an issue that's gotten as much airplay during the crisis. And I think it's so relevant to the SDGs and making sure they happen. So that is a constraint I think we will really face over time. And I'm concerned when I think, again, I look at Kenya, I'm like, we've had 6 months of this crisis. Have we built schools? And we're talking about capacity. Like, what are we doing with procurement of, we talked about the 1 laptop per child. The kids who were promised those laptops 6 years ago are now 6 years older, right? So that third issue around just our longer term human capital really, really does concern me. And I think will become a constraint to businesses large and small very, very quickly.
Great. Thank you, Amandla, for that. We have 2 questions in the chat. There's one around whether financial options for SMEs in Ghana are available irrespective of the political party you belong to. And I'll take that because I've been supporting social enterprises in my association to access the government funding. And I can tell you that if you apply and you meet the requirements, you will have access to finance irrespective of the political party that you belong to, but also piggybacking off what Adam said about associations and being part of a bigger group so that no individual business is being dealt with on its own sort of merit in lobbying, but you're being seen as a bloc is one effective way. If you happen to be a very politically active person who is also in business, that is one way that you can make sure that you can engage. Our second question from the chat is from someone in northern Ghana, Angela, and she's asking if these recommendations can work for someone in northern Ghana. Adam, you know Ghana well. I guess the suggestions he's asking, banding together, etc. Any reflections on maybe rural versus urban, or for the north of Ghana versus the south?
Yeah, thank you, Amma. I think if you're a financier, right, you tend to think more about industries and value chains, right, and what works where. And I would assume that businesses and the way and where they locate, right, are already indicative of what industries and value chains drive in those specific locations, right? And in that sense, then capital, should be agnostic to location. The other thing I would say though is something about visibility, right? Depending on where you are, you should make the required effort into making yourself visible. And that is super critical, especially in our environments, in places like Ghana, Nigeria. And if you're in Ghana, if you're in the north, it just means you have a lot more to do to make yourself visible, because the things that you seek, including capital, capabilities, etc., are just that much more harder to find and in limited supply, right? So if you do not make yourself visible, it's not only capital that is your problem to worry about, right? You also have talent to worry about, because people cannot go to places they do not know, right? And the best talent wants to go to the coolest places, right? So you do have a duty to make yourself visible if obscurity is your challenge, which I assume is what is implied in this question, right? So the question is, how easy are you to find? What are you doing to make yourself visible, right? So that the capital that is looking for businesses in these industries, etc., can find a way to you, but also some of the things that you need to actually improve your access to that capital, particularly talent, can find you. And also just like access to innovation and things that do not have so take, for example, I think someone mentioned the Google AI Center in Ghana, for instance, right? Now that's not something that necessarily has a cost to it, but if you're not visible, it will not find you, right? So it's not really about capital and where or where it's available. I think this is really an issue of you need to invest in making yourself visible if obscurity is a challenge, particularly in an environment where all the things you're looking for are in short supply.
Thank you.
And I can tell you for a fact there are some enterprises that are not necessarily the best in terms of their commercial fundamentals, but they're just the most visible and so attract all the things that you're looking for.
Thank you, Adam. And in this era of social media, there are many ways to be more visible inexpensively. Unfortunately, we've run out of time. The conversation has been so interesting. I wish we could go on, but we have just enough time for some concluding thoughts. So Amandla, as we wrap up, any concluding thoughts from you, especially from the perspective you have in agriculture? But I'll leave it open and ask any concluding thoughts on the topic.
Yeah, so I think you probably have guessed what my message is going to be. It's all about how we figure out catalyzation of SMEs. I think that the recovery path through the crisis is jobs, 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 and it's also jobs, jobs, jobs. And those jobs are going to come from SMEs. And so as you think about if you're a player that's higher up in the value chain, it's really to ask yourself how you can continue to support resilience of these SMEs. In some cases, formalization might be the answer, but you also cannot formalize by decree. So it's really that balance of trying to understand how you can best support the smaller SMEs further down the value chain. If you are thinking about starting a business, now is a fantastic time. There are dramatic challenges, but Andela, Uber, Airbnb, they were all started during the last financial crisis. And so if you have the opportunity to provide jobs for people, I think you have a personal responsibility to try and do that. And then I think from the government side, in really just trying to enable the environment for business, it's critical now more so than ever before. It's important for governments to balance that with competitiveness, because the consumer at the end of the day is not the person that has to struggle, but it's really about jobs and SMEs and how you can catalyze them is the path out of the crisis, in my opinion.
Thank you, Amanda, for that. Adam, any concluding thoughts from you?
No, I think it's, for me, I'd really like to see, I think Amanda mentioned some statistics earlier, right? About how SMEs are something like more than 60% of our economies. In West Africa, that concentration is actually much higher. So in Ghana, it would be somewhere between 85 and 90% of the economy is MSMEs. And not just in terms of number, but also in terms of employment, right? They actually employ the bulk of the population. So I would like to see, really, I'm really hopeful to see how that 80 to 85% constituency translates into a commensurate level of influence on the direction of government policy. Because it looks like right now that 80 to 85% has like 1% influence, whereas the 10 to 15% has 90% of the influence. So I would like to see that turnaround.
Thank you, Adam and Amandla. This has been really interesting. I hope you enjoyed it, audience, and you got some ideas, inspiration. And we look forward to that post-COVID world, and have a lovely, lovely afternoon. The next session will begin at the hour, so you can stay on. Over to you, Jerry.
Thank you very much, Amalate, and to you, Adam Sesi and Amandla. Ama, if I may ask, are you a gay girl?
I am definitely a gay girl.
Well, praise you of the first one. And so, ladies and gentlemen, it's been such an amazing session. And we are off now to another interesting one, transforming business strategies, aligning the digital to the physical world. Adam and Amanda alluded to the power of technology, how it has come in handy to provide convenience and ease for our SMEs, especially with fintech solutions whose innovative products and services have waived fees for online payments and other services within the e-commerce space. What we want to do right now is to explore further how we can transform businesses with strategies that will align the digital to the physical. To do that for us is Mr. Kojo Hesi, the Director of Express Pay, who will be hosting Madam Lucy Quist, Managing Director, Morgan Stanley. Kojo, if you're ready, please take it away.
Hello and welcome to the session. My name is Kojo Hesse and I'm a co-founder and director of ExpressPay Ghana Limited. ExpressPay is one of the leading financial technology firms in Ghana. I'm here today with the celebrated international business leader, author of The Bold New Normal, and STEM advocate, Lucy Quist. She's the first Ghanaian woman to head a multinational telecommunications firm. As former CEO of Airtel Ghana, she's a co-founder of the Executive Women's Network, and she served as the vice president of FIFA's Normalization Committee in Ghana. Lucy, welcome to this conversation.
Hello, and thank you for having me, Kojo.
Great. Today, we're discussing the transforming business strategies with a key focus on digital business transformation. We're very excited to have you here to share your perspectives on this topic, given the wealth of experience you have had and the expansive roles you have played in companies you have worked with. Welcome once again.
Thank you. And hello to everyone who has joined us today.
COVID has impacted the global economy, including Ghana, very significantly. Almost every aspect of our lives has changed as a result of the effects of COVID. It's caused us to rethink many social norms and economic norms that we have taken for granted over most of our lives. Many people have said that the COVID-19 pandemic has brought home the need for businesses to undergo digital transformation. What is your take on this?
Great question. I think it's fair to say that COVID-19's pandemic has affected Ghana, but it has affected actually the whole world, right? So we as a global family find ourselves in this situation where in order to preserve life, and reduce illness and keep economies going somehow, we need to find ways to effectively change. So I think my take is that absolutely there's a need for transformation, some of it that largely in this time being driven by the pandemic. But I think the emphasis here is really on transformation and the fact that we need to change the way we do things going forward. And I know you and I are going to talk some more and get into, the nuts and bolts of it. But I think we have to really remember that at the heart of it is the word transformation. It's almost as though digital starts to describe the kind of transformation, but what we're looking to achieve is the transformation element. So absolutely, we find ourselves in a place where preserving life and economies mean how do we change the supply chains? How do we change the way we do business? How do we change the way, we buy and sell things? So yes, we are part of the village that's affected.
Okay, so you mentioned transformation, you mentioned digital. Immediately when you put those together, I start to think about digitization. Is that the same thing, digital transformation and digitization?
Not entirely, right? And I think the best way I tend to think about it is that digitization can be a part of digital transformation, right? But you can digitize without digitally transforming, so to speak. I know it sounds really, so it can sound confusing because the words are so similar. So digital transformation, you're describing your transformation as digital and you're using technologies to transform your business, because we're talking about business here, but you can transform many things. Whereas digitization is literally taking a process and going digital with it. And I think your company, ExpressPay, and in Ghana is a great example, right? Because I have always been the kind of person who, because I'm an engineer, I like to find solutions and easier ways to do things. It's just the way I think about things. And when you think digital and you think payments, people have for so long been used to the physical action of actually going to make a payment either with cash or, as one of my friends in Ghana who runs a manufacturing company said, even with checks. She has customers who expect her to send someone to pick up the check in 2020. Mind-blowing. But if you take that same process and you go digital, I, for one, like to do all my banking online. It doesn't change the fact that I'm making a payment, whether it's by mobile money or whether it's to another bank account. What it has changed is the way I make the payment. I've gone digital. ExpressPay, you allow people to go digital. So you're digitizing a process, a payment process, which means you're reducing the need for human intervention and you're using technology to be more efficient in terms of bridging space and time. an aspect of digital transformation, but not the whole story.
Okay, that's interesting. As you mentioned, yes, our company ExpressPay has been sort of focused on providing a digital roadmap or a way for people to actually think about approaching the same problems differently. And I guess it can be expanded, as you mentioned, a bit more broadly. I like the example you mentioned about the manufacturing firm. How does this sort of work for them when you think about digitization? With a fintech, it's kind of easy to see sort of what digital transformation could mean, but can you shed a bit more light what this generally means then?
Yeah, so if I go more broadly and think about digital transformation, I think the starting point is that you want to think about the word, like I keep emphasizing the word transformation, because if you have a business and you want to transform it, then you have to start to think about, what is my business about? What is my business model? What's my vision for this business? Who are my target customers? Who's my audience? Who are my stakeholders? What are the processes that run this business? And when you can start to think about your business in these different aspects of it, which all form your business, right? All these come together to be your business, then you start to think about, okay, so how do I transform this whole business, all these aspects of my business, and still deliver on my vision and still serve my customer, right? So it's really important for digital transformation that we break it down. Okay, so some simple things to think about up front. Who is my customer? What is the kind of journey that my customer goes on? I've described myself as a customer of a bank who likes to be able to go online, right, and do my banking transactions. Fair enough. Well, that particular organization, to transform and serve me, has to ask itself, do we have the right technology, right? It used to be that I had to always go to a website, which is still digital transformation, to do all my transactions. Now I can do them on an app. You take the website, put it on about, even more convenient for me. So you think about your customer, you think about your customer needs, you think about the technology that can support meeting that need more efficiently. But also you have to think internally. So do I have the processes that support this digital engagement with my customer? And more often than not, a mature business will have the processes, but they will be manual. They'll be handing off from one person to another. They'll be so in a business that wants to serve its customers with a digital front, you have to start thinking about your own processes. When I go online and I make that transaction, what systems does it hit in your organization, and does that flow effectively? When there's an error in my transaction, do you have the systems that quickly call up the error and send me a message and say, hey, you see, this transaction didn't go through? So you have to think about your customer. You have to think about whether you have the technology to serve, and also what kind of organizational workplace culture are you building to support that digital transformation? So even when you're transforming digitally, you can't lose sight of the fact that you're an organization that serves real customers, that is all, run by real people.
Okay, I think when you put it that way, you make me realize that it really is a process. It's not you wake up today or yesterday and you were not thinking about it, and all of a sudden today you can say that you're digitally transforming.
Yes.
There seems to be more to it than...
It really, yeah, there's a whole lot more to it.
Okay. So when we think about this, just maybe taking a step back, why is this important really? Why is it important to today's business?
It's really important that we think about digital transformation and we work on executing digital transformation for a number of reasons. And perhaps to explain the why, it might help for me to explain a little bit around the how, because the how starts to tie us in why we should do it, right? So when you're, I'm terribly sorry. Is that not me? Oh, apologies.
No worries.
Okay, let me just switch this off, which I thought was off. but that's what happens on the Mac systems. Digital transformation means they believe that every system has to be connected, so that it's easy for you to, okay, I'm not having a loss of joy here. Okay, apologies to our audience. That has taken all of a minute out of our conversation, and I'm sorry about that. But okay, so why is it important? First of all, let's think about how would we do it. So I've talked about the people aspect. I think I've made it very clear that it's about the people in your organization, right? Are they equipped? Do they have the right tools? Have you built the right culture? So you want to overlay an element of cultural transformation, which is around shifting mindsets. You want to think about your processes, and I take a step back and think about processes from an engineer's point of view. Before you can digitize your process as part of your whole digital transformation, you need to standardize your process. If you have a process where it is run in 10 different ways, if Lucy runs it, she does it a certain way, Kojo does it another way, Abna does it another way, Amma does it another way, that is not a standardized process. A standardized process is one where whether I do it, you do it, or someone else picks it up, it's documented and standardized and run a certain way, right? So if your process isn't standard, you can't digitize it, because digitization is making your standardized process more efficient. It's not creating the process for you. You must have your process already. So another thing that you think about, and I'm thinking along these P's now, is productivity. Because think about it, if a process is standardized and it's efficiently run, then it means that getting the job done can be easier and quicker. So I should be more productive. I should be able to do more than the things I used to do. And ultimately, as a business, if you can have the right culture because you focus on your people, you can standardize your processes and digitize them. You can be more productive because you introduce technology. Then ultimately you can be more profitable because we have our revenue lines, which means that we can serve customers, we can scale up with technology and serve more customers. If we can serve the same customers more effectively because we're digitally transformed and we're running our businesses digitally, then the cost to serve should go down. And if the cost to serve goes down, then ultimately we should be more profitable, right? So this now takes us to why are we doing this? You have to do it because in this day and age, we have to be more productive, and especially on our continent of Africa, Ghana, so to speak, for the purposes of today's audience, we need to become much more productive. It is not an if or should we do it. It is when. We have to become more productive. Our productivity per capita is too low for the development that we need. We need to accelerate the development of our countries and our continent. And we need to do a lot of that through our businesses who are providing solutions. And if we're going to serve the over 1 billion people on the continent, then we need to be way more productive. So that's a long-winded answer to why should we do this anyway?
I think it explains it and brings it into the context. Hopefully, by taking this journey of going through the digital transformation, it will make businesses better able to serve their customers, and also as businesses make more money to be able to grow their businesses as well. But as you mentioned, it's a process. And sometimes in Ghana, we've been doing things for a very long time, the same way every day. It worked yesterday. Why, people may think, why do I need to do this today? What would you say to business leaders or owners who are thinking like that I sell water, sachet water. I've been doing the same thing every day. My customers aren't changing. My customers aren't digital, so to speak. Why is this relevant to me?
That's an interesting point. So first of all, I need to debunk one thing, which is your customers are changing. Okay. Every single day, your customers are changing. And I have to put a little bit of my telecoms hat on. Initially when I joined the telecom industry in 2008, the mobile penetration in Ghana, not smartphone, we didn't have smartphones. I know younger people think we've always had smartphones, but some of us know a world without smartphones. Telecom penetration in Ghana 2008 was 44%. We were all 2G. I remember having a relatively sophisticated phone, which was a BlackBerry running on 2G, and I would be in a place like Sishi, and when my email dropped, I was excited. Okay, young people on this call, do not laugh. It is the truth. I was really excited, okay? Fast forward to, it took Ghana much less than, it didn't take a decade. It must have taken about, I know, somewhere in the region of 6 or so years to get to over 100% penetration on voice. On data, penetration in Ghana is somewhere, I don't have the exact number off the top of my head because I haven't checked in a few months, but it's somewhere close to probably about half of the voice penetration, about 50% on mobile. In the cities, it's higher, right? Which means that if you were a company playing in the digital space, only in 2008, just 12 years ago, if you were running your model thinking that your customer is not changing, you're out of the water by now, right? Now, let's step out of telecoms and let's step into what's happening, what that actually means. It means that today, especially in our cities, but increasingly in our villages, I mean, I went to a funeral in my village in the Ashanti region, just my uncle's funeral two years ago. And I was shocked that I was pleasantly surprised, shocked probably, I did feel the shock, but pleasantly surprised that in our village, everybody had access to digital services. There was 3G everywhere in the village, right? Not in Kumasi, in the village. So what's my point? My point is that your customers are shifting. It means that your customer now has access to use digital, which means that you as a business, you either find ways to serve them differently, as we talked about earlier, or someone else who finds ways to serve them differently will take your customer away. And it can sound extremely sophisticated, like our insurance industry, where, really admirably, Hollard Ghana now has a digital chat service. So when you inquire about your insurance needs, you don't always have to actually speak to somebody. I think she's called, is it Abna Hollard or Adra Hollard? There's a Hollard, avatar that engages you before you even speak to anyone, right? Even our smaller businesses that, say, for instance, sell hair care products now have digital interfaces where you can literally have a chat, those automated responses on their WhatsApp. You can order online and it will be delivered to you. They say they're bringing it tomorrow. You can go through that entire process and not engage with anyone until the delivery. The delivery, of course, of physical goods, so that gets delivered. So if you were a seller, a retailer who thought, I'm selling hair care products, nothing is changing. So I have my table, I have my storefront and I've arranged my things and, customers are all the same, so I'm not going to shift anything, versus the person who can now serve thousands of customers centrally by distributing and going through this digital process without actually having to interact with them, who's attracting a bigger customer base? Because also bear in mind that what the person has done now is aggregated demand. Because if I'm making a delivery and I know that I have an order from Odoko, Official Town, Malam, Kaneshi, Waja, I have all these orders, what do? I aggregate them, right? Yeah. And reduce the cost to serve, because I've managed to aggregate it digitally, and reduce the cost to serve by making sure that the same delivery journey goes to all these locations. So instead of having 5 customers come to me, I provided the service to all 5 of them through a delivery and through a digital means, which means that I can probably actually get my money even sooner. So it all starts to add up. I mean, I could talk about this all day, from the smallest company to the largest company in Ghana. Digital transformation has a role to play. Now, it goes back to the owners and the people running the business. Are you prepared to go through this change? Because it is a change we're talking about.
I think that's a critical point you're raising. I like the examples that you highlighted. Very kind of top of the line chatbots. The Hollard has introduced, I think, a couple of other firms in Ghana have that as well. Yes. Even maybe want to highlight as well, maybe something like ECG did with the call center that they put in place, which was a simple, I think, tool that they used to make it easier for customers to report faults and help ECG also interact with customers, address any queries they have. So you're right. These are things that maybe at the same time, even the customers are beginning to demand, and businesses are also starting to provide. But as you mentioned, it is a process that companies have to essentially commit to going through. There probably will be costs associated with this. In your mind, what really are the challenges to businesses in Ghana being able to essentially start off down that path of digital transformation?
I think the number one challenge is mindset. And you highlighted a bit of it when you made the statement, well, what if I'm a business and I say my customers are not changing? And I think the first thing you have to shift in this change journey is your mindset. A mindset that embraces the fact that the Ghanaian customer continues to grow and mature, does want more services, does want more efficiently delivered services, and is going to demand more innovation of you. And that's one aspect we didn't touch on. But one of the other benefits of digital transformation is that efficiency doesn't only give you productivity, but it frees up resources for you to innovate and come up with new products and services serving the same customer base, which is great because as a business, you make more money. So the number one thing is mindset. I think sometimes we assume that digital transformation is such a sophisticated way of running a business that, quote unquote, it's not for us. Because sometimes we have a diminished way of looking at what we do and who we are. Look, it's an overgeneralization. I appreciate that. And it's not every business in Ghana, but I'm speaking more to the ones who are hesitant, the ones who are thinking, oh, if I engage a company like ExpressPay to make my payments more efficient, oh my goodness, how much do I have to pay them? No, I'm not going to pay. Instead of thinking, wow, if I engage an improved payment platform, I can serve this many more customers, I can be more efficient, I can make more money, I can be more productive and innovative. So number one is the mindset. The second thing is that if you can get past the mindset, then you do have to set aside some resources to invest in digital transformation, right? So I talked about standardizing your processes that already exist, which is really important because don't digitize something that hasn't been standardized and fixed. You'll be wasting your time and money. But so you need to invest in allowing people the time to re-engineer your processes to make them efficient and standardized. And then you want to invest in the technologies and the people know-how to actually digitize your business and go through that, digitize some of your processes, but go through that overall digital transformation. The other thing, probably the last thing I would add as a sort of top of the list is that take a long-term view because it's not the case in most digital transformations that you get it over and done with, in no time. I think the smaller your business is, the quicker you can go through your digital transformation. The earlier you get it done in your business life cycle, the better, because then you can kind of tweak it and improve it and expand. But for companies that are already really big or medium to large size, it can possibly take you a couple of years, even more, maybe even 3 to 4 years. I think you should be able to take that long-term view and look at what that will do for the business overall, and look at the fact that it will increase the longevity of your business into the future. Do you want a business that's just here for today and for you? Or do you want one that will transcend, your own leadership and your presence at the company? Because as a country, as a continent, we need more and more businesses that are going to survive really long term into the future. Again, back to my ultimate goal, to make our economies and our countries grow and make us more prosperous overall.
Okay. So yes, this commitment that businesses need to take on, as you mentioned, that they may need to actually invest in this process, and they need to think long term. To help that, are there any things that government needs to actually do? Are there specific policies that government needs to put in place? What has Ghana done right, maybe in this regard? And maybe what are some ideas as well that maybe you think the government can actually take on board to help make it easier for companies to start this process?
Yes, I'll start with what Ghana has done right. When you look at, for instance, the point I made about standardization of processes before you go digital, I mean, I recently went to the passport office, the one that's on the same grounds as the digital center, Accra Digital Center, and I was really impressed by the smoothness with which the process runs. Granted, some adjustments had been made because of COVID, so you couldn't directly sit next to people. But I was impressed by that because the process had been adjusted, the experience had been adjusted to take that into account. But it was such a smooth process that I can definitely envisage a situation where it becomes even more efficient through digitization, right? I think when the touch points that people have with government become increasingly efficient and increasingly digitized, it sets an example and creates a tone, right? Because after all, the government is the biggest organization in the country, which means that the vast majority, the highest percentage of interactions are probably with the government more than it, and I say government broadly in terms of the institutions and the parastatal organizations. So that's a great example of setting the tone. When you talk about policies and so on, I think it has to be the case that, look, in COVID, the response has been very swift and in terms of protecting the country. And if you look at it, we've tried really hard to use means available to us to provide some access to education for children, which has all had to be digital. Whether a TV is a digital device as well as a computer. Those of us who studied engineering, it was all, how do you transmit a signal? It's a signal, different kinds of signals, but it's a signal. So we've also demonstrated through that we need to start thinking of different ways of providing education as a service. So those are some really clear examples. If you start it from the top, it starts. Where I think we do, two suggestions I would have really very directly is that in the internal workings and operations of some of our ministerial organizations, again, parastatal organizations, need to look at how to standardize some of their processes and operations and how, when people engage with them, how does that come across? And so we need to build those efficiencies into the way the government actually runs. A lot more, and again, that sets the tone. I think the other area that I would say you need we can improve is some of our. So for instance, and I stand to be correct. I'm very happy for a member of the audience to correct me on this, but in my interactions, even if you pay your tax or your social security online, which you can do, you can pay directly to the account. So that's a tick, that's a plus. But the fact that you still have to present the paperwork is not. So we need to find a way that ensures that if I make a digital payment on tax or SNIT, there's a way of matching that I paid it, and so I don't have to physically present the paper. So we've digitized an aspect of it. There's a way to go. And again, I stand to be corrected. That has been my most recent experience. Maybe in the week since, everything has changed. I could be wrong. I'm always open to correction. But if we're transforming digitally, let's go the whole 9 yards, right? And I understand that some of it comes from the need for we don't always have fully transparent processes, or we don't always trust that the right person is doing the right thing. I think the way to get around that is to make sure that there's a strong matching process. And I think by the time we get things like digital IDs sorted and we can identify every citizen, maybe that makes it easier. But I think at the moment we have proxies. We have proxies like your SNIT number and your TIN as well, that we can use to get around some of these. So those are my thoughts based on experience. I speak based on experience.
Thank you very, very much, Lucy, for these thoughts and insights. You really brought this process of digital transformation, I think, to life and made it very practical and relevant to us. At this point, we'll take a brief pause here to do a brief survey from our participants today. And we'll come back afterwards to sort of wrap the session up. So, okay, thank you.
Thanks.
Okay, great. I think if most of you didn't realize, this was actually a pre-recorded session. We didn't want to run into any unfortunate mishaps for the majority of the session. But thank you ever so much for joining us and being with us. Welcome again, Lucy.
Thank you.
Yeah. We did a quick poll. Most of the people on the platform today with us here are government officials. Lucy, that'll help in terms of some of the thinking of what we're doing. We have, I guess, the next big segment of people who are participating with us today are entrepreneurs. So maybe in terms of some of the insights you provide subsequently, we can tailor them a bit more towards them. But
absolutely.
Yeah, I think we have some questions actually from the audience today. So maybe I'll just run through and you can share your thoughts on them.
Yes. Hello, everyone. Good to see you again.
Yeah, the first of which I think is kind of interesting, and it's digital transformation requires fast and reliable internet. How do you address this issue when the cost of internet is so expensive? And maybe I'll also talk about the reliability and the coverage of internet are also things which can be improved.
Yeah. Look, first and foremost, I would say that everywhere we find ourselves, there is room for improvement. And this conversation around our ability to have appropriate internet service, I do think has an element of bias in it. And let me explain why. So today I've joined you from the UK, but I was in Ghana for the lockdown. I arrived in Ghana at the end of March on the last flight, and I spent 5 months in Ghana. And the entire time I was in Ghana, I worked from home online, dialing into my work computer in the UK every single day, right? So first of all, I think we need to debunk this notion that you can't get reliable internet in Ghana. We can. Fair enough, to your point about coverage, it may not be in every single location, which has some truth to it, but we do have some major densely populated parts of Accra, Kumasi, Takoradi, our major cities, where you can actually get very reliable internet. And I'll be honest with you, I made sure that I had more than one service provider because it was really important. Now, I don't tend to like to overly personalize my examples, but I think this is a relevant example because being able to dial into a server is actually a big deal remotely. So we do have service. So one is that we need to find ways to actually either if where we live is not fully covered or where we work isn't fully covered, then there are solutions to that. And it's probably easier for a workplace location because you have a concentration of people there that can pull together and actually get a much better service. That leads me on to the other part of the question, which is around cost, which again is a very relevant question. So it's really hard to actually counter that argument because in as much as our mobile telephony is relatively cheap compared to many places in the world. So when you're using your mobile phone to access the internet, the cost per gig is actually quite low. But to have reliable work services, you need something, typically you need more than a mobile service. You need a 4G service or a fixed line service or a point-to-point connection. I completely get that. So we do have a challenge on the cost relative to earning power. Again, in absolute terms, the cost may not be too far off from what is in other locations, but relative to earning capability, we do have some work to do. Look, I think that we continually have interventions and engagements across the industry and with regulators in the government to address that. But one way I would definitely encourage our participation and how we can help as citizens is that actually the more of us who sign up to this service, we reduce the cost to serve, because that's also part of the challenge. Imagine if you built a cell site or you built a point-to-point connection and only 5 households in the whole area you're connected to sign up to the service. Effectively, your cost to serve becomes very high. I think the other thing is that the input costs, this is not something the audience can deal with, the operators have to manage, the input costs are high. So I think, can we get reliable services? My answer is yes, especially in locations where it matters most. The cost of the services relative to income is something we're going to have to continue to address, because in relative terms, I appreciate it can be high. So that feels like half of the answer, and yet it is as truthful as I can get. I'm not going to kind of like just sugarcoat it and and say to you, there's nothing to see here. I think it's just a question of relativity.
Okay, I think that's very useful, especially when you start thinking about the costs. And actually, Peter has a question that I think is very relevant to that in terms of the ownership of the underlying infrastructure. So let me read this question. It says the backbone of digital transformation is the fiber optic network, and these are all owned by telcos. Like all infrastructure, example, the roads and highways, there's typically a combination of government ownership and I guess a public-private partnership approach could be used. Given that the next generation is digitization, do you think it's time to rethink the ownership structure so that it is possible to provide fair access and a more, equitable approach to this?
Actually, my simple answer is no, which is a very closed answer. So at one point when I was working for Vodafone, I was actually running the wholesale business, which was the government infrastructure that got sold on. Look, I think in a digital, especially a fiber-led journey, if you look at examples of the UK, we studied examples of Singapore and so on. At some stage early in the journey, when the subscription is extremely low and the investment needs are very high, in many countries you find that governments start to build this infrastructure. And then some of this infrastructure gets eventually sold on and spun out to private companies. And why is that? Because in commercial terms, governments aren't commercial entities. And to be honest, in terms of core competence and skills, governments anywhere in the world are not the best people to run a commercial entity. It's just not the core competence of governing. Governing and policy making and regulating is very different from commercialization. And the other risk you face if the government runs all the commercial infrastructure, who checks on the government, right? When you have a separation between who owns and runs the commercial infrastructure versus who regulates it, then you have some checks and balances in place. So I don't think it's a matter of handing it over to the government. It's really a matter of continuing on the trajectory and the journey of building out our fiber infrastructure. Sometimes when we have these conversations, we don't always compare apples to apples. We compare ourselves today with others. Let me qualify that. Before telecommunications went digital, in fact, before it even went mobile, in many countries, it was all cables, right? And it was the cable infrastructure that provided fixed line. And that cable infrastructure became sort of the foundation that would eventually evolve into sort of the fiber-led, so cables were replaced and you put fiber optic cables, right? Why is this relevant? Because at the time, some of the countries we compare ourselves to, when people didn't have mobile phones, they still had fixed connections to their homes and offices, right? What was our experience? Our experience was that actually we always had very limited fixed subscription in Accra, I think Kumasi and maybe one other city, but it was very, very limited when we had just Ghana Telecom, if you recall. Maybe some of you might be a bit young. And so we went from that very limited base, it's a really small base relative to our population, straight to mobile, right? And mobile was a big boom for us. And then we had to go back to fiber. Well, guess what? The fiber, the fiber, especially last mile fiber that goes to people's homes and to offices, was not there. We had fiber connecting sites and making it more efficient, but we hadn't built out fiber in terms of last mile, the way cable was a last mile. So we're on a journey, which thankfully we have now created. I think Ghana has done a great job in creating a combination of not just fiber to people's homes, but actually decently reliable fixed mobile services. So my point is that I don't think what we need is a handover to government. It's not the most efficient way to run a commercial entity. What we need to do is actually continue on the journey and the trajectory that we've done. And where government can play a role, I guess, is to support with some of the policies and regulations, and also the vision of where Ghana wants to go on its digital journey, so that commercial businesses can take a cue from that and fall in line and work together to achieve that.
Thank you. Let me move on to another question that we got, which is that digital transformation generates a large amount of data, which also needs to be processed and used for decision making. As a country, is this something which, as a country, we need to think about, or is it more of a private enterprise that needs to be undertaken by entrepreneurs? And what do we need to do to think about that?
This is a very complicated question. And it's a question that actually speaks to something that really concerns me, because we are already generating huge amounts of data, right? Let me know, even before I talk about commercial businesses, every time you post a photo, every time you comment, every time you send a message, that's all digital. Every time you plot that route on your map, every time your Fitbit records what you're doing, every single day, every single one of us in Ghana is generating huge amounts of data. So let's establish the fact that the data generation isn't the future, it's here and now, right? So then back to the heart of the question, what are we going to do about it? It's a combination, I believe, of both the commercial business entities and enterprises and government, because a lot of the data being generated is actually being generated by private businesses, right? So in the earlier chat, we talked about transactions. We talked about how businesses have to serve people better and differently. Every single one of those has multiple data points, information and data that the commercial business should be storing, because it's for future reference, for track record, for actually analyzing and understanding their customer behavior, so on and so forth. So we've established that the data is being generated. We've established that actually in the first instance, a lot of the data generated is quote unquote owned by the entity that manages the data sourcing and so on. In terms of storing the data, actually in Ghana, we have a glut of data centers that are both government built and privately built. So data centers to store the data are not our biggest, a big challenge. Maybe there's a cost associated with it and we need to store the data and so on. Then that leads me to the final part of your question was about what do we do with the data? And this probably is the part that concerns me more than anything else. Now, I know from past experience that we do have data protection, some data protection laws in Ghana and regulation. We need to continue to build our capacity around regulation to protect what data can and cannot be used for. We need legislation that ensures the enforcement of whatever those regulations are, and also the appropriate means of prosecuting if there are breaches. At the same time, we need to actually use data beneficially. And that's where my concern lies. My concern lies in the fact that we, as far as my experience goes, have such a limited number of data scientists who really, I'm not talking, the simple analysis, data scientists who can really, really crunch that data, crunch big data, we have a very limited number. And to put that into perspective, I remember about 3 years ago, I visited, it's 2 years, I visited one of these massive online businesses. I won't name it, it's a global business, but it was one business, right? And they did this seminar and I went along and I sat in and I listened. And this single business had 60 data scientists, PhD level data scientists, 60 of them. And I sat in the audience and the only thing that came to mind was, wow, I wonder whether I can find 60 PhD level data scientists in the whole of Ghana. And I've asked the question repeatedly of many people who I think are in the know, and I come up short. I haven't even found 5 at that level. Now that I say it's basic inquiry within my network, so it could be more than that. But do you see the relative, what I'm trying to put across here? We have a huge opportunity with the data that's being generated in wanting Ghana to become, a leader when it comes to digital and in Africa and around the world. And we need to develop the skills to actually manage that data, to monetize that data, to do better as companies with it. And I'm afraid to say that on that particular point, we do have a distance to travel.
Okay. So given the audience that we have today, there are some government officials here, very specifically, both in terms of policy and also in terms of activities that government itself as a service delivery agent can take on. What specific things would you want them to walk away with in terms of key points that they should be looking and thinking about? You've mentioned, human capital. Are there other very specific policies that maybe you want to help them bring their minds towards?
I think if we use human capital as one example, because the question you ask is such a loaded question, right? As one area, then it starts to say that actually the support that we need goes beyond just one particular organization, right? Within, and we're speaking specifically about government here. So, what kind of education are people getting? What are the opportunities to actually train in data science? How much capacity do we have in the country to train data scientists? How do we ensure that the people who may not be data scientists but have access to data fully understand the importance of the accuracy of data? And I found this, unfortunately, where, for instance, you engage and someone's capturing your address and they write the wrong address. It happened to be very recently in Accra. The instance shall remain nameless, but I wasn't happy because the person insisted that it was okay to capture a wrong address for me for something that was actually, from an ID point of view, extremely important. So I refused to continue the process. I went away, I went home, I came back and the next day and I said, look, I need to do this, but I'm not going to let you enter in your database an address that is not my address. So this whole attitude of, it doesn't matter, it's just a minor error, accuracy really, really matters. If we're going to become a data-oriented, data-driven country, data that is inaccurate is effectively useless because it will lead you to make wrong decisions. So it's not just the human capacity of the data scientist, it's the capacity around understanding the importance of clean, accurate data is a major factor. And also the ability to protect the data that you have access to, the data that you're privy to, understand what you're privy to. If you don't have sort of levels of access requirements based on people's responsibility, then make sure you introduce that, because it's really important that all data isn't available to everyone and it is used appropriately. So I think a lot of my ultimate point is that where we are today in our journey, we need to get people to a point of understanding that, look, data is the new oil, it's the new gold, it's the new everything, because we live in an information age and you draw inferences from data. I mean, the hearsay and conjecture is not information. Inferences from data, that's real information we can make decisions from. So let's get that right.
I like that. It's important to get the right data. And you mentioned things like addresses, KYC information. So I think some of the things which government is doing in terms of the national ID system, the national address system, these really feed into this new data-centric model that comes with transformation, right?
They absolutely do, but they have to be accurate, right? Because this leads me to my example, and it was a state interaction that the person thought it was okay to capture an incorrect piece of information. Now, does that mean that I blame the entire institution? Certainly not. But this one person I was dealing with thought it was okay to enter his own proxy for my address. And so that means that that person on the front line, the system is fine. There's nothing wrong with the system. The process is fine, but that human interaction, and if I wasn't me, because apparently they'd done it to other people, they just enter whatever address they wanted to enter because it's easier, it involves less pain. So we do also make sure that people, not just the systems are right, but the people are right to take advantage of the systems being introduced.
Okay. So you mentioned before that this, digital transformation is a process. So as a country, realistically, what kind of time frame should we be setting ourselves to go down this process?
This is a very interesting question, and it's one that I am unfortunately going to disappoint you on, because it's hard to give a time frame, and I tell you why. It's not just about the introduction of the systems, but really the adoption of the systems and processes. So do I think, and if you think about it, the systems and the processes build on each other, right? So if we don't get the baseline right, the next step becomes more difficult and more difficult and more difficult. So what I would rather encourage people in terms of everyone listening is that we actually have to treat our digital transformation as a country as a matter of urgency. So urgent means that as soon as possible. If you wanted my simple answer, I would have said yesterday. When do we have to transform? But I would have said yesterday. But that's not a realistic response. So the more realistic response is that let us all treat it as a priority, as a matter of urgency, right? We're a country that has demonstrated a huge capacity to adopt new technologies, new ways of doing things, when we want to, right? And then another instance is where, the old way is fine, let's just leave it. I don't know why you're making life hard, blah, blah, blah. If we can all make that mental shift to saying that, look, in this age, digital transformation it's not even a requirement, a requisite, it is the future. We're living through a pandemic. What the pandemic has done is just accelerated the process for many institutions and countries because we're left with no choice. But it's not as though we weren't on these journeys before, because we needed these journeys. There's a recognition that we need to digitally transform, but COVID has accelerated that. So everyone on the call, let's treat this with urgency. It's really important.
Thank you very much. So now switching over to maybe the entrepreneurs who are listening. I think one question came up was, what resources are available to companies who want to go through the digital transformation process? Are there consultancy firms who can assist them? Or are there particular resources, for example, books that you would recommend that they read?
Oh gosh, there are glut of books. It's hard to really push any specific book, but honestly, and some of it's not even books you need to buy. Some of this information is available freely online. I remember spending time looking at the software release process that Spotify applies, right? And they've kind of really adapted their model, and it's improved their time to market. And this is all free on YouTube. So I would say that, first of all, in terms of access, the knowledge, if you're starting on this journey, don't jump into spending lots of money. I would say first, try and do as much self-study as you possibly can, what's available online, but also connecting with other companies who may have done this and just sort of pick their brains, because you don't want to jump straight to spending money. You want to seriously give this thought and plan it. The second thing I'd say around companies that provide, consulting services around this, I think we have a few, not sort of massively big presence, but we do have a few on the ground that you can connect with. But I would definitely say don't engage that conversation until you have taken the time to understand what it is you're looking for, because it can be in phases. I remember one of my former colleagues saying to a group we were speaking to that sometimes for your company, your digital transformation just starts from the process whereby you take a piece of paper from the controller to the finance manager to sign, to the marketing manager to sign, to this one to sign, and you make it electronic. And there's no walking around with paper. And maybe that's your first step in transforming, where suddenly, instead of walking around with a piece of paper, you have adopted an online system where I can approve and the next person can approve and the next person can approve. And you start to test the waters and see what your organization is like. Or you go for payments and you say, okay, we used to do only cash. Now we do mobile money. Actually, now in addition to mobile money, we're going to find an intermediary that allows mobile money, Visa, all these other platforms. And you build up that way before you dive into the massive spend. Now, if these things that I describe are things you're already doing, great. And I would say in that case, then you might want to consider the investment of having, a consultant come and look at your entire business and make recommendations, or you recruit someone who has this experience to lead the digital transformation for you.
Thank you very, very much, Lucy. I think we're pretty much out of time, and this conversation has been extremely interesting and provoking. But before we leave, are there any final thoughts you'd like to share?
My final thoughts are this: I think every single sector of our country could do with being sort of more efficient, more effective. That goes without saying. I think in the earlier conversation, I talked about the fact that we need to be more productive, because as we increase our productivity, we will actually shift our development and accelerate it. And it's something I also actually wrote about in my book. We need to accelerate our development. Technologies are accelerated. We don't have the luxury of waiting around. So I would say to everyone, don't treat this as just a government responsibility or an entrepreneur's responsibility or a school's responsibility, so on and so forth. It is our collective responsibility to bring this to life. We will get there quicker if we do this together. So I hope we can all walk away with a sense of, okay, I need to figure out what I need to do on this journey to make it go quicker. Those would be my last thoughts.
Thank you very, very much, Lucy. We really appreciate it. For those of you who'd like to learn more about business transformation, I'd encourage you to get Lucy's book, The Bold New Normal. A shameless plug from me for you. But yes, we're looking forward to seeing a lot more businesses in Ghana embrace the digital transformation process. And hopefully that will drive a revolution of change and growth in our post-COVID world. Thank you, everyone, for joining us today, and have a great afternoon. Thank you.
Thank you very much, Kojo, and thank you, Lucy. And Lucy, isn't it amazing that before COVID, you wrote about the bold new normal? What should we expect after this?
Oh, you see, you must be at least the third person nudging this pressure this week. So it'll come.
Thank you very much for the warm insights.
Thank you. Good to see you.
Okay. And so, ladies and gentlemen, that was another powerful one. Time allows us for one more, the very last session for today, which will feature the HR Director of Vodafone Ghana. She'll be hosted by the founder and director of Leading Ladies Network, the Executive Director of Emerging Public Leaders, Madame Yawa Hansen Kwao. They're going to be discussing the future of work post-COVID-19. Yawa, if you're ready, take it away with Ashoka.
And welcome to this all-important discussion on the future of work post-COVID-19. This critical conversation requires us to seek the insights of distinguished professionals within corporate Ghana, and we are privileged to have an opportunity to talk about this important topic with a distinguished woman leader from Vodafone Ghana. She is currently the head of HR for Vodafone Ghana, and her name is Ashiokai Akron. So without further ado, welcome, Ashiokai. Thank you for making time for this discussion today.
Thank you very much. Thank you very much, Yaba.
Such a pleasure to have you. And for the benefit of our listeners or our viewers, I would like to start off by asking you to kind of help us understand what do people mean when they talk about the future of work, especially because we're hearing it and it's becoming a buzzword. Before we start the conversation proper, can you help us set the stage by helping us understand what future of work really means?
Yes, absolutely. And good afternoon to you again, Yawa. So the future of work concept, the phrase has actually been around for quite a few years now. And it referred to, initially the impact of technology, right, on how we work in terms of automation, in terms of artificial intelligence, digitization, and how all that was coming together to impact the way that we work, how we hire to how we retire employees, and basically how it impacted our whole workspace. Now, of course, when COVID-19 happened, the whole pandemic, that has significantly accelerated all of that. And it has really forced all of us to really look at the way that we work. And it has forced us, again, to look at our reliance or non-reliance on technology for some people. So how quickly you were able to mobilize using the technology that you had in the organization, really spoke to how ready you were. And so the whole future of work thing was looking at technologies that we have and how that was really going to impact on the way that we do work. So again, if you look at how organizations were able to mobilize, I mean, when literally about 90% of the world went on lockdown in late March, we all quickly had to figure out how to step up using technology throughout the whole employee journey, like I said, from hire to rehire.
Well, thank you for setting the context and helping us truly understand what future of work means. And as you rightly pointed out, since March, many of us have had to transform the way we work.
Absolutely.
I'm speaking to you from my home office, where I've been tethered to for the 6 months and trying to run my teams from, the four walls
I can imagine.
Of the
same here as well. So for us at Vodafone, we've been working from home as well since the middle of March.
Wow. Yeah. So for those of us who are going through this on a small scale, it hasn't been easy. So I can imagine for companies, for governments who are going through this on a large scale, this presents its own challenges. Can you talk to us about some of the challenges associated with digital transformation?
Yeah, absolutely. So I'll answer that in our context. Since the challenges will be, they'll be different depending on which part of the world that you find yourself. And so for us, I would say that some of the initial challenges that we have had was skepticism, first of all, right? About how far-reaching, this whole concept of digitization and transformation even is. With some even thinking that, it's still a faraway concept from us, which couldn't be more false. I mean, I think that this pandemic has really shown us that couldn't be more false. And also for us, access in our parts of the country or in our parts of the world, access to some of the technological tools that would even the playing field is even a challenge. So there's such a huge divide still that needs to be bridged in terms of even data access to all, so that we can, start speaking the same language and we can leverage on the tremendous potential that technology provides. The other challenge is on the part of employees is the fear of some who are either not willing or who feel that they are, inadequate to learn these new digital skills and to fill the roles of the future. So, those are some of the challenges that, we face in our part of the world. And very quickly, we have to, look at all of them and address them, look at where we are currently, where we want to be and what the gap is, so that we can put together, meaningful plans to address some of these challenges, because it is here to stay. I mean, some of the things that we're talking about is here to stay. I mean, during this pandemic period, we've seen how very quickly some organizations were, literally able to mobilize their whole organizations to working from home. I told you that for us, we've been working from home since March. Even with our call centers, we've had to set them up at home, to do that work. And so, if you don't have that capability, and it doesn't have to be on that large scale, even for small, scale, small sectors, small and medium enterprises, informal sectors, there is even using your smartphone, right? And being able to do work from your smartphone if you can't go outside of your home, if you can't go outside of your restaurant, etc. So yes, it has come to stay, and we do need to really outline the challenges so that we can put together meaningful plans to address.
And one thing that COVID-19 has seemed to have exacerbated is this divide between rich and poor, have and have-nots.
Yeah.
So for example, self-isolation is somewhat of a privilege.
Yeah,
there are some people because of where they live and how they live, that just was never possible. We have seen in some countries, especially COVID-19, disproportionately affecting communities of color, those who were kind of lower on the income bracket. So as you look ahead, and as you perhaps, as an employee of a tech firm, as we think about the millions of people around the world who are in the informal economy or don't necessarily have immediate access to technology, even these smartphones that we, kind of take for granted now.
Exactly.
What do you think the future looks like for them post-COVID-19?
Yeah. And you're so right, that it has really highlighted more the divide, right? The economic divide between what would you call the haves and the have-nots, and even with education, right? I mean, we're seeing it live where, institutions, private institutions were able to go fully online and have classes continue without disruption, and then have, other schools who are not as privileged, with students who are not as privileged, who don't even have access to laptops, to iPads, etc. And for them, it's literally having to be in the classroom to be able to learn. And so their education has to be put on hold for a while. So that divide is definitely something that we have to look at. Looking at organizations, and then looking at like you said, the informal sector. In our part of the world, where the informal sector, especially in Ghana, I mean, it's estimated to be about 80 to 90% of the population. It is even more important for us to pay particular attention to how we digitize this sector. The pandemic has definitely impacted this sector, and we've seen more of these small businesses, medium businesses going online. It's been very exciting, actually, from delivery services to food to produce. We've been inundated, on social media with businesses who are going online through the power of technology. And it's been, like I said, very, very exciting to see. And there's tremendous, tremendous potential. There is no business, I really believe that there's no business that cannot leverage on the power of technology and innovation. And it's extremely important that we help to harness the power of that informal sector. First, by giving them access to data, by giving them access to, various digital platforms that they need. For us at Vodafone, September is actually dedicated to small and medium scale enterprises. So, we actually have an impressive number of offerings and programs and training programs that we're looking at to train those in the informal sector on how to digitize the work that they're doing to try again to bridge that gap that we have. So more and more, we need to be doing more of that.
Yeah, thank you for that. I do want to take you back to the education space, though. As a parent, COVID-19 has been hard to supervise learning online, and many schools are opting to continue tuition online for the next academic year. What would you say are the modifications that the education space needs to make in response to this new normal or this new reality? If more young people, or even older people, because colleges and universities are also,
absolutely,
many of them are online. So what modifications do you see ahead for how we educate people for jobs of the future?
So I think our focus has been more on the classroom learning, the theoretical, and then at the end of the semester, the year, then you have the exam and you pour it all out. You quickly forget, you move on to the next. It has to be now more and more. It has to be continuous assessment, where you're able to assess the student as they're doing the work, having meaningful conversations, be it online if we can't meet in the classroom, and everybody having, if it's a topic that we have to discuss, having read it already, having, done the case study, having gone out to do further research, and then coming together to discuss, hearing from everybody's viewpoints about, their ideas on the topic, and then hearing, of course, from the teacher, the lecturer, on their views as well. But the modifications that need to happen, in the educational sector, I think it's a dual role, it's a dual responsibility between academia and industry, and both have to play their roles if this is going to work. We recently met with Professor Rita Akusia-Dixon, who's the new Vice Chancellor of the Kwame Nkrumah University of Science and Technology. So she came to meet us at Vodafone with her team, and that was one of the key things that was on her agenda that she wanted to talk about. She was wanting to partner more with us, even looking at curriculum and getting input from us and industry on, what are the future skills, what are some of the things that we're looking at, and how the theoretical can come alive in the classroom. And so we need to have more of such discussions and open forum with academia, with industry, and active partnership to ensure that our students are not being shortchanged, right? And they're job market ready upon graduation. That they understand what the skills of the future are, and what, that they have been adequately prepared to step into these roles. The skills and roles that we're looking at for the future, including like cybersecurity, which is a huge sector that's opening up, software engineering, digital marketing, artificial intelligence, robotic process automation, there's a whole host of them. And do our students really understand what these skills of the future are? And are they being prepared through their coursework to be, ready to step into these roles? I would also encourage students, well, maybe not just students alone, but even employees, right, for development, personal development. There is so many free online courses that are being provided by various institutions, a number of free websites, including, Udemy is providing about 1,600 different courses on digitization, transformation, even Harvard University, Yale, Coursera. You just have to go online and Google free courses or free digital courses, right? And there's a whole host of them that come up. recently Microsoft partnered with LinkedIn to provide a number of free courses as well on their LinkedIn page. Digital courses from, project management to web design to digital marketing. So there's so much free content that is outside of there as well. So don't just rely as a student just on classroom coursework. Save some of that data that you're using for Instagram, for TikTok, etc., and get another skill, get a meaningful additional skill as well to your toolkit.
I totally agree with you there. There is a lot of movement in the online learning space.
Absolutely.
And I think that there's one possibility that this moment has enabled or accelerated. I'm on the board of directors for Ashesi University, and we have had to learn very quickly in these past several months how to transition to online learning, but also, as you were talking about, to add on the experiential part, which is, a little more complex, but not impossible. So for example, our engineering students, they can no longer walk into our labs because campus is closed. So we've resorted to sending individual lab kits so people can conduct their experiments in the safety of their home. So yeah, I'm definitely really interested in what's happening in the education space. And I'm really glad to see what Vodafone's doing and partnering with some local institutions to make that possible.
Yes.
So leaving the education space, I'd like to go back to the workspace. You and I are working from home, and we may still be doing so for the next couple of months.
Yes.
Do you think we will ever go back to how things were? Will offices remain vacant for the foreseeable future? What do you see on the horizon for the future of how we work? Do you see us ever going back to a commute to a building, or is this forever how it's going to be?
Yeah, so that's the question of the moment, right? So that's the question that everybody's asking, from business leaders to HR leaders, everyone really is in this figuring out mode. I mean, we have organizations who decided to go full 100% remote. A couple of years back, I think it was last year, IBM decided they were going to, do 100% remote. And now we're seeing that they are changing their perspective and looking for a more hybrid type situation where they're looking at bringing people back into the offices. Of course, not, during this pandemic, but eventually. So, I mean, here's what I think. If you've built the digital and technological infrastructure to work from anywhere, that's great. But I do still believe that we need the physical workspace. So we do need the physical workspace, but how and what we use them for is what's going to change, right? So now work can be done anywhere. I mean, we're that's what we now proving, right? That work can be done anywhere. But getting together for things like collaboration, team bonding, brainstorming sessions on different work aspects and different projects, and other such work that is best done, together. There is an advantage in huddling, and also for our part of the world where we have network issues, we have power issues. It's still not optimal, right? Having people work 100% remote from different parts of the country. So I believe that a hybrid type situation is what we're going to have, is what the majority of us will end up having. And it certainly gives us tremendous opportunity to look at, remote working has given us the opportunity, and also it's forced us to look at the opportunities that come with it, right? So for example, you don't need to hire within the country that you are. Now you can look outside for talent that, has usually been very difficult to come by where you are. Now you can open it up. I mean, I have filled roles. I recently filled, a few roles that I had open for quite a while from outside of the country. And because we're in lockdown, they have actually been working remote this whole time from outside the country. It's working out pretty fine. So I believe that, definitely there is a lot of opportunity to doing a lot of work remote from anywhere, from home, from anywhere you find yourself. But there is still going to be that need to have that physical workspace for things like, like I said, the getting together, the, bringing people together around building, the spirit, the purpose of the organization, and making sure that you don't lose that. There's CLC, the Center for Creative Leadership, says that. So the research, the 70-20-10 learning, right, which says that 70% of learning actually is done on the job, where you learn by observing others, you learn by asking questions of your manager, by asking your colleague if something comes to mind. If you're working on something, they can quickly roll onto your desk and show you how it's done, etc. And so that's how 70% of learning actually happens. And then the 20% is done, through mentoring, coaching, all of that stuff. And then 10% is actually what's we learn through active classroom, being in the classroom, learning and training and stuff like that. And so if you look at that 70%, which is, the on-the-job learning, it becomes quite at risk. If you look at, if you're going to work 100% from remote, you can't do that, but you need to pay particular attention to ensure that, especially for new employees who are joining, who haven't had the opportunity to work before, like fresh grads, interns, national service personnel, that they are not losing that aspect where they learn from observing, they learn from asking questions and huddling and collaborating and all of that. So, that's what we're looking at. I mean, we're getting our interns who are starting, our national service people who are starting. So we're putting together a plan on how we can give them the actual experience, the actual Vodafone experience, while also, working remote. So it's a long-winded response to your question, but I hope I answered it. So I do believe that it's going to be a hybrid type situation going forward.
Yeah, thank you for that. And I think, where you've ended has been quite an interest to me, especially when you're onboarding new talent. How do you, in a moment like this, where in-person meetings are less possible, how do you maintain company culture? How do you foster a sense of collaboration and unity? And what would you say has been, your best learning, especially in this past 6 months, of kind of overseeing talent for this major enterprise in Ghana? What advice might you have for other companies about how to continue to foster cohesion and to inculcate a sense of values and shared, bonding?
Yeah. So when we were on lockdown, where you literally cannot, go anywhere, we did a few onboarding for new employees because we were still hiring at that point. And so everything was done virtually. What we insisted on was, you have to use the video functionality. A lot of the time, I think we've all gotten used to, oh my goodness, I woke up in the morning, I haven't done my makeup, especially for us ladies, right? I haven't done my makeup, so I'm not going to put my video on. You have to put your video on. It allows for, even seeing the person and having the discussion changes, and you become more engaged in what it is that's happening. So that's like a quick thing. And then also ensuring that everybody who has touch points with that new employee gets to meet that person. And so HR has to facilitate that discussion, one-on-one, quick 15-minute discussions, where the new employee is introduced. Our CEO, we have her doing, she was doing a twice monthly session with all employees on our platform. And so she would announce who the new employees are, who have joined us, if any. And then, we'll have them say, they'll type in a few words if they are online. But now when the lockdown lifted and we are able to go into the office, it's very we have set limits for how many people looking at social distancing. And so the whole office, not more than 20%, we've said can be in the office. And so teams, so for example, my HR team, I have a strategy session with my HR team in a few weeks, and we're getting into the office to do it, and I'm encouraging those small type meetings for us to go into the office because I haven't seen them in forever. So everybody's excited, right, about get it together, even the social distancing, and ensuring that we pick up on the fireside conversations, the water cooler conversations outside of the work that we do. And you have to proactively do those things to ensure that you're still keeping we call it the spirit of Vodafone. Every company, I'm sure, calls different values, but that engagement with employees is still very much alive. You have to keep that going.
And my last question will be about what you've witnessed over the past few months. Have you seen a disproportionate effect of working from home on different categories of staff? For example, sources saying that parents during lockdown, have really experienced difficulty, especially, women who are single parenting, or, parents that bear the brunt of the housework in addition to work. What are you noticing? You are overseeing the talent for a company that hires hundreds of people. Are you seeing any particular trends about how working from home is affecting, people's ability to deliver work in a manner that they were previously accustomed to?
Yeah. So when we started, I think we started working from home March 15th. So when we all, went home and we started working from home, everyone was excited, right? About, oh my goodness, I get to work from home and I don't have to sit through hours of traffic to get to the office, which was all well and good. And that lasted for a while. And then we saw that because what we started doing was every month we do a pulse survey. To see how employees are doing. And it's literally about 5 questions. How are you feeling? Do you have the tools you need to work? Do you feel connected to your team? Do you have, I think, your goals? Do you understand your goals as outlined by your manager? And then there's a 5th one. So basically, we were trending those, questions as we did the pulse survey. And in the beginning, how do you feel question was pretty high. It was about 90%, 95% thereabouts. And then gradually we saw, that decreasing quite a bit. And so we did, small focus groups to understand what's going on. And what people were saying was, I'm kind of tired of being at home. There's disruptions. Because some of us have kids, and then the kids were also doing this online school as well. So in between that, and then as well, we saw there's a lot of meetings, right? Because you can't just walk over to somebody's desk and ask them a quick question. So the number of meetings has tripled for all of us, right? It's like from one meeting to the other. And so people were feeling a little worn out. And then the whole stress of COVID and everything, mental well-being issues also started setting in. So then we put in place, a number of things. One of the quick things we did was we said, no meetings between 12 and 1, and then no meetings after 5. We also got a psychologist to come in and do a session with us on stress and how to, practical things to relieve stress. Other mental well-being things that we did as well. But yes, you have to absolutely, keep an eye on that because, employees were very gung-ho about, yay, we're going to all work from home 100%. And now what we're hearing from them is we miss our colleagues, we miss having the discussions, we miss, what we don't miss is sitting in traffic and going to work. And so we would like some kind of hybrid situation where, you can have the best of both worlds. But for what I tell line managers who are worried about, I've said no to line managers who are like, well, I want to go to the office because I don't know whether my employees are working. No. So you should be able to know exactly what is it that you've asked your employees to do. And it can't be same with, what I was talking about regarding academia, where we can't wait to assess students at the end of the year. You can't wait to assess employees at the end of the year or at the end of the quarter. It has to be more frequent now. And, you have to know your employees. Some can work and don't need the motivation, the daily calls to get their stuff done, and some do. And so you need to figure out who needs what. And so maybe Monday morning, having a quick check-in meeting with employees. Okay, let's go around the horn. Who's working on this? What is everybody working on? And then Friday, a quick check-in again. Okay, this is what Kofi was supposed to work on. Akosia was supposed to work on. Where are we? What were the barriers to getting it done? Is there any help that you need? So you need to be more hands-on as a line manager and have those discussions, those performance discussions more frequently to help, especially those who are struggling.
Well, thank you for that. I think that's such a really great example to share for those of us running companies of different sizes. Some of the strategies that you used could be useful. And in closing, this is my final question. So many young people will be graduating this year or have graduated this year in a moment of great uncertainty and volatility. What would your advice be in terms of how to set themselves apart in this moment so that they can find meaningful work?
So I'll go back again. I made the reference to the, don't be idle. Okay. If you can find the data to, do all the stuff, all the fun stuff online that, you're doing, don't be doing TikTok 100 times a day in your house. Find time to, like I said, there's a whole bunch of free courses online. You just need the data to log in. And even some of, some of these are 0 rated. And so you can get on and learn one more skill. We've started this new initiative at Vodafone where we're doing a hashtag one more skill. So everybody should, learn one more skill. And so arm yourself with that. I mean, if you can get a certification, I made reference to the Microsoft LinkedIn partnership where they have all these courses, and you can literally get a certification, a digital marketing certification for $15, starting from as low as $15. And so, or, you're able to, I think, apply for scholarships and stuff. But the course itself, the whole course itself, to arm yourself with a skill is free. And so, don't be idle. 1, get the skill, and then 2, follow up. If you're not on LinkedIn or on some of these professional websites, make sure you're on and, get in touch with people. See who you know in the organizations that you want to work with. Find out who you have in common in the network and have them introduce you to somebody in there. And I was on this program and I was telling them that sometimes HR people, or, we get a little, especially when we don't have roles for entry level and you're like, oh, I really want you to hire me. I really, I really need a job. I'll do anything, etc. And sometimes we just don't have those roles, but it's very difficult for me to say no to, if you ask me, can I just come in for 1 week and help you out with a project that you're working? That is not threatening, right? And who knows what that 1 week will lead to. And so, I mean, I was very impressed right then. There was a lady on the call who asked me, okay, so can I come and do something with you for a week? I was like, yes, absolutely. First of all, thank you for speaking up. And so, my team is working with her now, and who knows where that will end up. But try and find those networks and ask to be introduced to people in the organization. When there is these panels going on various topics, try and log in, listen, and I think they have it really tough. I mean, I have to say they have it really tough because a lot of organizations are not hiring, and so, but it will pass, and they will be stronger for it, depending on how they choose to use the time.
Yeah, excellent words of advice. Thank you so much for your time today.
Absolutely.
It's been a pleasure having you speak to this very critical topic of the future of work. Thank you so much for the work that you're doing with Vodafone and the great support you continue to lend, not just as a company, but also, to the future leaders as well. So thank you. Ladies and gentlemen. We're going to open up for questions and interactions at this time.
Thank you very much, Yawa. Thank you.
So ladies and gentlemen, I hope you enjoyed the pre-recorded discussion that I had with Ashiokai Akron, the HR director for Vodafone here in Ghana. We are sending out poll questions. If you would take a minute to answer the questions, that would be amazing. And for those of you who have sent in questions ahead of time, thank you. And if you have a question now, you can send your questions via the chat box for this particular virtual discussion. So Ashiokai, if you can hear me, I do have 2 questions here already. And I'd like to go ahead and ask you.
Yeah, I can hear you okay.
Awesome. Thank you for the awesome discussion that we pre-recorded. And as I was rewatching it, it was just filled with gems of wisdom, and I'm grateful for your time and thoughtfulness. We have received a couple of questions, and in this session, we want to spend about 15 more minutes for the audience to ask whatever questions they'd like to ask of you. The first question I have here says that the pandemic is putting immense pressure on households, both economically and socially. And so with so many workers now that are working from home, what's your opinion as an HR professional about the fact that many families and many employees are having to spend a lot of money on purchasing data in order to, support their kids' learning, as well as their own ability to work? What would you say to that, and how do you think there's an argument or a case to be made for getting companies to underwrite these costs?
Yeah, thanks very much for the question, and good evening to everyone. So this is where I would say, employees and organizations have to work together to find some winning options. Because on one hand, you have employees who are, asking for these new incentives based on the new ways of working. And on the other hand, you have employers who are trying to keep costs down so that they can keep the operations going and not have to lay employees off, right? Which, sometimes is the unfortunate end result. So what we can do is relook at our policies. And so take a look at the total benefits package that, the organization currently offers, and see if it's worthwhile replacing some of the benefits that you currently have for employees with what they need now. So I'll give you an example. So if you're an employer who currently offers, let's say, transport allowance, right, that helped employees to get to and from work, or entertainment allowance, or clothing allowance, can you look at those and swap them out with some of the things that, if your employees are working from home, are asking that they need now, which is extra data? I know that, a friend of mine actually told me that, some of her employees were asking for, electricity bills to be paid by the organization. So, as HR leaders, as senior leaders in the organization, that's what we have to look at now. We have to look at our policies and our total benefits package that, we offered employees, and then look at if we can do some trade-offs. That way, it's not such a burden on the organization that is already going through, really difficult situations. And that way as well, employees do get some of the things that they need to now to work.
Yeah, thank you, Ashiokai. I think you're right that some companies are having to go back to the negotiating table and just see what can give at this moment. There's another question about data, and this question is really referencing the studies that have gone on around the world that indicate that Africa has among the highest cost in terms of the cost of getting online.
Data.
You are, an employee of telco who provide data services as well. There's a question here about what do you think can be done in general to bring down the price and the cost of being able to get online?
Yeah, great question. I mean, especially now, all of us are, being challenged with how much data we're all consuming. I mean, we're consuming data in such exponential quantities. So looking at the cost, I think you mentioned, the cost of data in Africa being one of the highest. Yes. If you look at Ghana, we're actually, I think the last research that I saw on this, we're about the 6th cheapest in Africa. But looking at the cost of producing data, the cost of producing data is expensive. If you look at the cost of spectrum and other things as well. But I mean, I must say that we are very gratified with the government's recent decision to reduce the communication service tax from 9 to 7%. So that will definitely provide some relief to employees, to students, and everybody who's having to work from home or utilize data to get their stuff done, to get their work done. And so, more and more, there should be more provisions like this. There should be more opportunities like this. And it's going to be a partnership between government and private sector to look at, looking at ways where we can make data, less expensive and also more accessible to all.
Yeah, thank you. I know that that's a question on the hearts of so many people. If you look at your bills for the past couple of months and what you're spending on data, I know that for many of us, it's horrendous. There's a question. Right. There's another question I will ask from the audience as well. It says, how do you drive employee engagement during a period like this? And if I can add to this question, because this is such an uncertain moment, I can imagine that stress levels are high and people are tense, and even, things like keeping your team focused might be a problem, in addition to figuring out the logistics of how to work remotely. So the question is, what's your advice for employers, entrepreneurs? How do you drive employee engagement in a moment like this?
Yeah, that's a great question. And I would say the first thing you have to do is communicate. It's as simple as that. So just because, you're not seeing physically your employees, you're not all huddling around, doesn't mean that, you shouldn't have those Zoom meetings, those WhatsApp calls, or all other platforms that you use to communicate, right? If you're, the manager of a small business, if you're of a small, and you currently have your employees working from different parts of the country, it should be a platform, and you should put together the frequency of how often you're going to engage with your employees, have an agenda, have a plan, and have the employees partake in those discussions as well. And then set aside some time for fun, right? What's going on in everybody's mind? How are you feeling today? What are some of the things that you've done in the last week, etc. For us, one of the things that's, I think I mentioned earlier that we did was having our CEO fireside chats, where the CEO, basically gets on our internal workplace platform for 30 minutes and then 30 minutes for questions. And so everybody asks the questions that's on your mind. The other thing that we did as well for engagement is we used to have these quarterly engagement sessions. We call them quarterly engagement sessions. It's called Red Connect. And we'd get together, usually we'd get a DJ, would just get, drinks and, just huddle around after work and, just chill out. Now, of course, we couldn't do that, 90% of us working from home. So we decided to move it online, to do it virtual. Again, after work, we got a DJ who was doing the thing from their house, tuned into our, workplace platform. Employees logged on with their families. Everybody was dancing. Everybody was, just chilling and having fun. So it's simple things like that you can do. And what it does is it really keeps employees together. So although you're apart, you still have people talking about what's happening, discussing what's going on, and coming to you with the questions that they have instead of, talking to different people and getting the wrong information. So like I said, communication is very key. So provide a platform for that to happen and for employees to engage. And yeah, still have fun. I mean, everybody likes to have fun. So try and find what works for your organization. And, we did movie nights. And basically what we did was stream a movie and everybody logged into a Skype platform and we all watched and we all, chatted on the platform. Yeah.
Yeah, those are excellent examples of ways that employers can boost employee morale and keep people engaged, even in this digital moment. I know over the past few months, I've attended online comedy shows, I've watched movies online, I have attended virtual graduations and parties and funerals. It's been different, but better than nothing. Yeah. So I thank you for the tips about how we can be creative. And I applaud the Ministry of Finance for being creative with this conference. Absolutely. Because we're leveraging the virtual platforms to continue these very important conversations. Yeah. I have another question here from someone who must be an entrepreneur. He's asking, can we consider that COVID-19 is an act of God and therefore a valid basis for canceling contracts, perhaps laying off employees? I've heard in the news, different companies are referencing COVID-19 as a reason to lay off staff members and things like that. So from your kind of compliance and HR background, I'd love for you to speak to this question. What can people get away with in this moment? Can we write COVID-19 off as an act of God and not pay our taxes or let go of people?
That's a very interesting concept.
Or can we not do?
Yeah, I don't think I've heard it put that quite that way before. I would say that the first thing that you do, if you've done everything you can to save employees and it's gone to crunch time and you literally have to let a few people go to get the, in order for the operations to continue, the first thing you do is, if you don't have an in-house legal team, is talk to a lawyer, an employment lawyer, so that they walk through. One, they have to look at the contracts that you have with employees. This is going to be different from company to company, right? And so let them look at your employee contract. One, let them advise you based on the labor law that operates in Ghana, and advise you on what you can do, and also what your commitments to your employees are in these circumstances. Fortunately, we haven't had to, lay anybody off during this time. We are literally, trying to keep a handle on costs, and all employees have been asked to really, make sure that they are handling costs. If it's not necessary, don't buy it. If it's not necessary, don't sign that PO, etc. But I understand, for some organizations, they've tried everything and it's still they still need to let employees go. But don't take a decision on your own and assume that you can get away with it. First of all, it's not fair to the employees, right? I mean, your employees will remember how you treated them. I always tell people that. And so as they're going out there, they are going to be your brand ambassadors, okay? So if they're not going to be your customers, they're going to be friends with your customers, family with your customers. And so there's nothing that works more than an employee who leaves, who is an advocate for your organization. So let's treat people fairly, even as we're going through a redundancy, and make sure that you have the law on your side, because yeah, it will end up being more costly if you take random decisions.
Great advice there, and I hope to the one who asked the question, the insights are well noted. So Ashiokai, there's another question here that I would love to get your feedback on.
Yeah.
We know that COVID-19 is a big deal, such a huge disruption, but Ghana had some other problems before COVID-19 arrived. And one of those problems was youth unemployment. So I have a question here. Someone's asking, what's your take on how to get large companies, maybe like Vodafone, to take on more young people and take maybe an expansive or creative view of what an internship program could look like, to absorb some of the thousands and hundreds of thousands and tens of thousands of young people that are, qualified but unemployed currently. And their recommendation is that, is there a way to incorporate this as part of corporate social responsibility? What's your take on that?
Yeah, and you know what? It doesn't even have to be corporate social responsibility. It should be part of the way you work. Because you get so much more from graduates, these young people who are coming into your organization and infusing your organization with their knowledge and just the sheer they have so much passion and to innovate, to change things, right? And so sometimes you need that spark in your organization. So a few years ago, we put together at Vodafone, so every year in HR, we have a youth objective, a youth employment objective. And so literally I have it in my goals that this year we have to hire a certain number of youth. So that is anyone below the age 25. And so that's usually, graduates coming in. And so if all organizations can do that, I think that will help us well through national service, either through internships, either through different programs, that you have. So for us, we do national service, we take in national service personnel, we take in interns, and we have a program called the Discover program, where we take in graduates and they go through an accelerated leadership program as well at various, departments or various divisions of the company. So, if all organizations, and it doesn't have to be, you don't have to hire 1,000, right? It depends on, the organization and how big or small it is. You can set yourself a goal of having, 5 people, or even just 1, or 1,000 if you can afford it. But there's so much benefit to be had from bringing in, young people, young graduates into your organization. And then it's so much beneficial to them as well, because they're learning from, from working with other people, from the experience that they get. And of course, it ends up benefiting the whole society and every one of us. So if all organizations, if all of us could give ourselves that yearly goal, that yearly target, and then, I was just on a call with my talents, head of talents and recruiting this morning, and I was letting her know that, look, it doesn't matter that we have COVID, you still have to beat your number, your youth number. And so it is something that is, I would say, definitely beneficial to the organization, and then to the, the unemployed students, graduates who are coming out as well. So we do need to look at this more responsibly.
And just as a follow-up to that question, can you give us a sense of the number of young people you're hiring every year at Vodafone?
Yeah, so last year, and so it's different buckets. So we have interns, national service personnel. National service, we do about This year we're doing 60 because of COVID and having to work from home. We literally had to look at what parts of the organization we can let people come in and do their national service and still work remote, because the entire 90% of the organization is still working remote. Interns, we got interns as well, but because of the school cycle, we could only have interns come in. Usually we have them come in for a whole year, but we could only have we let them come in for the whole. I don't want to say summer. We don't have summer in Ghana from, vacation, the long, vacation period. But this year, because of COVID, the universities had different dates. And so we had our interns come in for 2 months. Some came in only for a month because they had to go back to school. And then for, our graduates program that I mentioned, the Discover program, we take 16 a year because that's a more structured program. We bring them in as full-time employees. These are people who've graduated. They work with us for a while. They get opportunities to go to various opcos across Vodafone, sometimes in the UK. I have someone who's going to Qatar in October, and different parts of the world as well. And so and then we have the more temporary ones. So we open up opportunities for like a week, 2 weeks for people who are in SHS as well. To come in and do some experience. We call them apprenticeships. So there's different, buckets that we have. Last year, my goal was, I think it was just over 500. This year is a little bit more. So if you put all that bucket in there, we have to meet it. COVID is proving awesome. Very challenging, but we have to do what we can.
That's great. So that means your target is to employ or give opportunity to at least 500 young people in Ghana this year. That's amazing.
Yeah, that was last year. This year, we want to improve on that. And so we're doing, the best that we can with working from home and, trying to still give the opportunities. But yes, definitely.
Mm-hmm. Great. I was at a conference a few months ago, and there's some research that was presented. And it showed that, given the number of unemployed young people all over the world, but particularly on the African continent, it would mean that every company would at least need to provide 300 jobs each year in order to fill the gap, to fill the void, and to get everyone employed. And I remember thinking to myself, oh my, how many companies in Ghana, which is where I'm from, how many companies in Ghana can actually realistically hire 500 people a year? So as I think of this as a bigger problem, and that's why I preface this by saying COVID-19 is a big problem, but it's exacerbating some of the big problems we've already had.
Absolutely.
Such as youth unemployment.
Absolutely. And if
as
you look
we look at the stats.
If you look at, oh my goodness, I can't hire 300 people. So you can't look at it like that. You have to look at, like I said, the size of your organization and what you can do. And it's all about committing to what you can do in any given year. And if you want to, improve on that on the next year, there's another program that we have, another, opportunity for graduates. It's called the Female Engineering Scholarship Programs, the FESSP program, where we partner with different universities across Ghana. So, KNUST, University of Ghana, Aseshi, Ghana Telecom University, basically all universities. And we bring their graduates in when they are in their last but 1 year. And we provide them internships, mentoring. We pay for their fees for the last year, and then when they graduate, we bring them in and we give them internship opportunities as well. And then they go on to do different things in our organization. One, it's a great pipeline for us. It's very beneficial for us because it's building up our female technology pipeline, right? Because as you all know, it's very difficult in a technology organization to find the female talent. And we have a commitment to, ensuring that we have a certain number of females in even management levels every year. And so for us, it really helps us because it brings in the female talents across the country from various universities. We get to nurture them, we get to help them out with scholarships, and then they end up coming to work for us. So it's a huge win-win.
Well, that's awesome. And I don't see any other questions from our audience, so I assume the topic is very well understood. I really thank you for your time today, Ashiokai, and especially the insights and tips for entrepreneurs and for young people who are all trying to navigate this moment. And I hope and pray that as we are all just trying to figure out this moment, that as we think and envisage the workplace of the future, that these tips and insights will help us make the best choices possible. So on that note, ladies and gentlemen, we bring this particular session to an end. Thank you again, Ashiokai Akron, the head of human resources at Vodafone Ghana. Thank you for your time and insights. And thank you, ladies and gentlemen, for including us in your agenda for today.
Thank you very much, Yawa.
And what a glorious thing, such a session. We thank you very much, Madam Yawa and Ashiokai. And isn't it amazing that long before any political party or any interest groups thought of agitating for 4 months of maternity leave, Vodafone had already stepped into the fray. And thanks to Ashiokai and the team for such a great legacy for Ghanaian women and for parents in Ghana. I guess you can't hear me. Okay.
Thank you. No, we can hear you. Thank you very much. Thank you very much. Yes, it has to happen. I mean, the times are changing and we have to change with it.
Okay. I guess that's exemplified in your tagline. The future is exciting.
And we're ready.
I hear. And so all too soon, this is what time will allow us for. We want to say thank you to all our panelists, our moderators, and our participants. You've been with us from 2 o'clock up until now. Tomorrow, we conclude in grand style. We shall have only one session and it will be a very great one. We would have 4 amazing panelists who will be moderated by Mr. Kofi Enin. We shall be talking about the last leg of the discussion on our theme that we're reflecting on. We urge you all to please join us at exactly 12:30, 1 o'clock, I beg your pardon. It will be live from 12:30. So at 1 o'clock, we go live. On behalf of the team right here at the Ministry of Finance, together with our team from Ministry of Planning, GIPC, and the SDG unit at the presidency, we'd like to say thank you to you all. Let's do this again tomorrow, and we shall close in grand style. Good night.
Welcome everyone to